I would like to just reiterate
So this is I mean, my phone is just
Recording in progress.
I was already concerned. Sam? Yeah. ಆಯ್ತಾ ಮೀಟಿಂಗ್ ಮೀಟಿಂಗ್ ಆಯ್ತಾ
pharmaceutical industry. In this wise, I want to commend Pharma for its plan to scale up to a level capable of realizing Nigeria's industrialization goals. Also, with the advent of COVID-19 pandemic, the pharmaceutical sector around the world have begun to sort contract manufacturing as a means of ensuring drug security. The global growth of the sector from 934.8 billion US dollar in 2017 to $1.17 trillion in 2021 further gives us an insight into the exponential boom to this industry is experiencing. Vaccine production in Nigeria. Nigeria's efforts at being a key player in human vaccine production has been characterized with some challenges that at present we cannot say we have any vaccine production capacity. The only human vaccine production center which was active for about 6 decades was the Federal Vaccine Production Laboratory in Yaba, established in 1940, and it last produced a human vaccine in 1991. Before it was shut down, the facility produced all vaccines for yellow fever, smallpox, rabies, among others, for most of the West African countries and other parts of the continent. Several attempts at resuscitating the facility have not yielded desired results. Aside from our inability to have a full functioning human vaccine laboratory and production plants, what is presently up and running is an animal vaccine production laboratory. The National Veterinary Research Institute in Plateau State, which has been effective in producing vaccines for the livestock industry. These institutes make a number of vaccines for the local market and for export to other countries in West Africa and sub-regions, as it produces viral and bacterial vaccines against several diseases of livestock, including cattle, sheep, goats, and chickens. It is my belief that if we can be self-sufficient in animal vaccine production, it can be reciprocated for human vaccine production, as we have virologists, molecular biologists, and experts in genomics of infectious diseases whose capabilities can be harnessed for immediate impact. According to the World Health Organization, Africa, which has 14% of the world population, has less than 0.1% of the world's vaccine production. Therefore, the need for self-sufficiency in vaccine production puts Nigeria in a strategic position to lead the vaccine revolution. Vaccine production is capital intensive, as it will cost a lot to revamp and increase the production capacity of the moribund facility and even set up a new ones to meet present realities, which is why the federal government is in talks with the World Bank's private lending arm and other lenders to raise about $30 million to help finance and vaccine plan. 3 decades after the country's only produced facility was shut down. Only recently, the government announced a 10 billion naira fund to support domestic vaccine production to tackle the COVID-19 pandemic, as well as improve immunizations routines, which reducing dependency on international donors. It might also interest you to know that the federal government and the African Export-Import Bank are working out modalities towards partnering in terms of pharmaceuticals and the production of vaccines. Distinguished guests, ladies and gentlemen, government is gradually increasing investment in the health sector, as it obvious from our fight against the COVID-19 pandemic. The pandemic further exposed deficiencies in our health sector, which government, in partnership with the private sector, subnational levels of government, and development partners are all working together to improve. I had used this case of vaccine production to indicate how the federal government is promoting the substances of pharmaceuticals industry in Nigeria that could be comparable to our global peers. Government is working with the private sector in all aspects of our health sector to ensure we provide necessary health benefits to our people. In conclusion, I want to assure you that the federal government takes the recommendations from this type of conference seriously and will continue working to improve.
We boast of over 60 research and development pharmaceutical companies. As a matter of fact, some of the member companies started operation in Nigeria from manufacturing. Companies like Pfizer, like Glaxo, and a host of even Merck, and a host of others. And globally, members account for over 50% of the global pharmaceutical market. In Nigeria, we are not just trading. We're actually contributing to economic growth. We're an employer of over 12,000 pharmacists and allied professionals in Nigeria. So we do provide extensive and huge employment to Nigerians. For us, our goal is to collaborate with governments and local manufacturers, and we desire to restore the local pharmaceutical manufacturing capacity to its lost glory days. We produce innovative medicines which we make available, and this includes vaccines, biologicals, and medical devices, which are used in the treatment and the diagnosis of critical diseases in Nigeria. In the wake of pandemic, we can see clearly how our members rose to the epidemic. As we speak, some of our members have developed and launched COVID-19 vaccines, as well as other adjuvant therapies in curtailing the scourge of the pandemic. So I'd like to give you a perspective around what obtains in the Nigerian pharma space. According to McKinsey, when you exclude donor products and vaccines, the market was estimated at around $1.4 billion as of 2016. And the base case forecast is that it will be about 3.6. It will be about 3.6 by 2026 and $4 million best case scenario by 2026. So it has capacity to more than double between 2016 and 2026. Also, according to UNIDO, you have the various therapeutic classes that are very significant in terms of our local consumption and what the factories are producing. We have the analgesic, anti-rheumatic, antipyretics accounting for 25%. You have multivitamins and hematinics accounting for 15%. And you have anti-malaria medicines accounting for 14%. And the rest is filled by the other therapeutic categories. Besides this, when you look at the manufacturing footprint, 60% of the footprint in West Africa actually in Nigeria. So there is huge opportunity that we could serve both domestic and the economic region, ECOWAS. But majority of the factories manufacture analgesics, anti-rheumatic, and antipyretics. Within this, the idle capacity is put at 58%. This is huge. You see, that's a paradoxical case in the pharma industry. On one hand, we have idle capacity of 58%. On the other hand, according to PwC, PricewaterhouseCoopers, we still rely largely on imports to meet local demand for medicines in Nigeria. And within the locally manufactured products, the domestic demand or local demand is being met by just about 4% to 25%. But the good thing is there are opportunities, as many parties are looking for opportunities to manufacture locally, including the multinational companies, looking for right partners to manufacture with. As we speak, we don't have dedicated contract manufacturing facility. As we speak, we've lost opportunity to partake in international procurement tenders. CHI used to be one, but I think they have lost that right. Also, few or non-existent capabilities to manufacture complex formulations. So we need to choose how we move forward. We desire to localize, to reduce import bills on pharmaceuticals, but we must face reality. I think the low-hanging fruit, the idle capacity, how do we bridge that through contract manufacturing? That is what we should be looking at. So for us in Aeropharm, we've articulated a roadmap to local manufacturing. It's building synergies for a Nigerian global supply chain. So the vision we have, which is in sync with the policy direction of government, is to make Nigeria the hub, manufacturing hub of high-quality pharmaceuticals in Africa. We desire that Nigeria becomes a net exporter of pharmaceutical products and a net earner of foreign exchange with implementation of the AFCTA. At the same time, while trying to achieve localization, we believe we should not jeopardize drug security through contract manufacturing and local production by way of drug scarcity. Whatever we're doing through local manufacturing to provide drug security should not jeopardize drug security. We also believe, as our vision, that through technology transfer and contract manufacturing, we can optimize existing capacities. Part of our vision is to ensure contract manufacturing policy is in place and in use. We are grateful to the policy framework drafted by NAFDAC. Beyond manufacturing, we desire that Nigeria becomes the epicenter of pharmaceutical research and development across Africa, and we can do it. So what's our position? So our position first is we wish to highlight the critical steps to localization drive and suggest ways to optimize existing capacities of the local manufacturing facilities. We believe that we build the required local capacity for products that are not currently being manufactured in Nigeria. This we can do as Nairo Farm. We've seen in other clients like India, China, Turkey, Egypt, South Africa, best practices where collaboration between the local industries and the multinational companies has, really led to the growth of the local companies through contract manufacturing. In India, this be alluded earlier, they are net exporter. Volume-wise, they are highest producer of pharmaceutical products all over the world. And they produce not only for domestic, they equally export to all countries. To do this, the first step is that we've designed or come up with a matrix. And the matrix is to put products in categories based on what we feel are the local manufacturing capacity. So we've put this into 5 categories based on capacity to manufacture locally. Category A, proven, subject to, tested data, proven and adequate. Category B, proven but inadequate. Category C, not manufactured in the country, but can be. Category D, cannot be manufactured in the country due to patency or the know-how process is difficult to replicate locally. And category E is currently classified others, not categorized in benchmarked countries. So our roadmap are 2-pronged. The first is about contract manufacturing. This is a low-hanging fruit. The idle capacity can be filled, technology transfer can happen. But what is contract manufacturing? Contract manufacturing simply means manufacture or partial manufacture of products by one entity for the other entity. That's contract manufacturing. And we need to recognize that it is impractical, not feasible for all companies to set up its own manufacturing facility. The ones that are available, we need to optimize their installed capacity. So what are the benefits of contract manufacturing? 1, importers and local manufacturers working together will improve capacity utilization. There will be lower production costs because the capacity is maximized. You are using the same staff to run out more tablets or liquids, so your cost is down. And you have improved local capacities. Number 2, and this is very important, is the technology transfer. The know-how. Through this pathway, you'll be able to get the know-how from the companies that own those intellectual property. And subsequently, you'll be less dependent on other nations, and the issue of increased drug security can be achieved. This will foster strong partnership between the local manufacturers and the distribution or marketing companies. More importantly, more investments inflow will be attracted in Nigeria. Also, there will be less dependency on Forex for pharmaceutical products. And all these are in line with the government's agenda to ensure that we achieved localization. So for us in Narrow Farm, we've looked at the category A, proven and adequate. As a matter of fact, some of the products on this category A, which we have penciled down, are already in sync with NAFDAC's list of trying to encourage localization. And we are committed as Narrow Farm to engage with local manufacturers to contract manufacture these products in category A. But we have some conditions because you know where we're coming from. R&D base, you see our values, where we stand and all that. So there are clearly about 4 areas that are key to us. The first is about the manufacturing, good manufacturing practice, the condition of the factory. We would like that to be over and above the very basic. This one works in tandem with us. If the partners cooperate with us, it prepares them to be acceptable in other markets because of the quality of the products. Well-defined contract manufacturing operations, including specifying how toll fees, IP protection, and volume delivery arrangements can be attained. High ethics and compliance standards, must have been audited in the past 3 years and deliver standard and transparent manufacturing costs. These are some of the issues that we feel needs to be put on the table. When you talk to the regulatory agencies, they say, these are commercial issues. But these are commercial issues that are germane to be fixed so that the partnership can work. At the moment, about 5 Narrow Farm members are in active technology transfer with contract manufacturing projects with local manufacturers, and many more are still, planning to do so. So we need the right policy framework to make things to happen. So next is how can we foster good manufacturing policies in Nigeria? The first is about adherence to contractual agreements. We need an arbitrator, and we appeal to step into this shoe and help to resolve some of the issues. We talked about the framework. We've had input to the framework already put in place by NAFDAC. We would like some of the areas we listed there, which are highlighted earlier, like toll fees, IP protection, to be looked into. Also, on the contract agreement is a periodic audit of the manufacturing facilities, capabilities, and capacities by both NAFDAC and FMITI, and the results will be shared transparently to all stakeholders. Number 2 is the intervention, government intervention by way of fiscal and regulatory policies. We want government fiscal, regulatory, and monetary policy framework to recognize contract manufacturing as local manufacturing and support its growth in our industrialization plan. 2 is the acceptance of bulk manufacturing as a contract manufacturing and the use of manufacturers' identification number on the packs. This is a practice in other crimes. You don't put your factory name on it. It's a number. It's a number. You put my name, my company's name, then you put a number. The number identifies the factory where the product has been manufactured. Number 3 is improved interaction between importers and local manufacturers. This is critical. You can see in other crimes, people come from India to look for importers here, OE markets. We need to see a way where those who have idle capacity in Nigeria, the local manufacturer, are to proactively engage the importers. I have this capacity. come and manufacture in my factory. We need to see that. Need for increased number of WHO pre-qualified factories. I think that one cannot be belabored. And number 5 is extend government manufacturing incentives to contract manufacturing. Incentives such as power infrastructure investment write-ups, 0% duty on raw materials for pharmaceutical manufacturing. And we also desire that all this should be included in the contract manufacturing framework being developed by the Federal Ministry of Industry, Trade and Investment. This is one part of the jigsaw, contract manufacturing. But you know, there are frameworks to implement policies. And for us, we've seen that along the line, as we do all this, proper implementation of the contract manufacturing, certain aspects of the fiscal policies needs to be tweaked. The HS code, this is the code for each product. When you import or whatever you do, the way it's currently structured, a lot of products are lumped together. And we believe this needs to be simplified and further broken down to ensure that the sub-classification will enable ease of implementation of duties. It works hand in hand with contract manufacturing because certain policies may be implemented and that will put it in the right direction. So what's our ask as NARUFAM? First, we want data to be shared on available capacity and GMP rating of local facilities. Number 2, is to categorize the product that currently being proposed for 2 phases of accelerated contract manufacturing. So we are proposing 2 phases of products for accelerated contract manufacturing. But the baseline, as we all are aware, NAFDAC has proceeded. They have the 5+5 policy, and the baseline is you have to, after some period, you need to submit your roadmap to localization. That's the baseline. Okay? For category, after fulfilling that, for category A, which should be 3 to 5 years, we are products with proven capacities and capabilities that can be localized. And for 5 years to 7 years, for products that will require technical partnerships in order to meet the stringent quality requirements for not only multinational companies, make them more acceptable in other export markets. This is very critical. That's why we can become net exporter. And number 3 is that as we speak about contract manufacturing, some will be greenfield, that is the startups. Some will be brownfield, the existing companies that want to go into this line. CBN should provide low-interest loans to countries engaged in contract manufacturing. Distinguished ladies and gentlemen, in the last couple of minutes, I've tried to share with you who NARUFAM is, the issues and opportunities in the Nigerian pharma space. I've tried to share with you our localization drive as NARUFAM. NARUFAM is committed to manufacturing products locally, and we just want a more rational and a more thought-through process for us to deliver that. Thank you, and God bless you.
Thank you very much, Mr. Asuni, for the very detailed roadmap you've presented to us. And so at this point, ladies and gentlemen, we would like to take a short break of about 15 minutes for one of my favorite activities of the day, which is breakfast. So breakfast is served out here. So we'll just take a 15-minute break and then we would return for the first panel of today. Thank you. If I could have just a bit of your attention, please. So we'd just like to inform everyone that we'd like you to be a bit mindful of your belongings as you step out and come in, please. Just try and be a bit mindful of your belongings where you leave them on your seats. Thank you.
I'd like to play one of our new songs for you right now. I read somewhere that King Sunny Ade had stated that he heard a piece of music and knew immediately that it was my sound. And that comment blew me away because to me, the greatest flattery that anyone could say was that I have a unique sound. And that's what I'm working for. That's my goal is to come up with something that's different and my own.
Good afternoon. Oh, well, it's 2 morning. So good morning again, ladies and gentlemen, and welcome back from breakfast. So just before we go to the next item on our agenda, I would like to recognize the presence of pharmacist Ibrahim Binji, the Deputy President of PSN for North, who is here representing the PSN President. You're welcome, sir. And so to start off on our very first panel for today, the panel is on contract manufacturing, the practical story. Our speakers on this panel are Mr. Kunle Oyelano, the MD, GlaxoSmithKline, pharmacist Ade Popola, CEO, Reals Pharmaceuticals, and we have Folake Odediran, country lead, Sanofi, Nigeria and Ghana. So I would like to start off by inviting them one after the other to please come up and have their seats here. So I would like to start with Mr. Akunle Oyelano, the MD GlaxoSmithKline. So please come up to the stage. Pharmacist Ade Popola, CEO Reels Pharmaceuticals. You're welcome, sir. Folake Odediran, country lead Sanofi, Nigeria and Ghana. And I'll welcome myself too as the moderator. Okay. Yes, no, I need him to get another one. Share this. Oh, let's just leave it here. So this panel conversation is essentially to understand contract manufacturing and the practical story of how it operates in Nigeria at the moment and the potentials. So the question I'm starting with, which each panelist would give a very brief insight on it, is by trying to understand why you chose to explore contract manufacturing as an expansion strategy for your own company. And so we'll start with Mr. Akunle Oyelano, please.
Thank you very much. Let me say good morning once again to the audience. I lead the GlaxoSmithKline Group in Nigeria. And to your question, when it was obvious that we needed to expand our footprint in terms of our volumes, there were a number of options for us to consider. A little bit about GlaxoSmithKline, actually. We've been in the country for about 50 years plus, and we've continuously been in Nigeria for over 50 years. And many people may not know, but we are quoted on the stock exchange. And in reality, we are majority owned on the stock exchange by Nigerians. So whilst it's a multinational company in Nigeria, majority of our shareholding is held by thousands and thousands of Nigerians. And that's important because we consider ourselves to be part of the fabric of this nation. We are a global company, a multinational pedigree, but with a very strong local footprint in the country for the last 50 years. So when it was obvious that we needed to increase our footprint, drive our volumes, there were a number of options that we thought about. One was to increase our current capacity in our factory that we have in Nigeria. One of the options that we looked at. We also thought, could we bring in some of these increased volumes from manufacturing networks all across Africa? And but based on the fact that, like I mentioned, the fabric of we were part of the fabric of the country, and we consider ourselves a local company with a global pedigree. One of the decisions we took was to explore partnership collaboration with a local manufacturer, because we thought to ourselves that if we were to increase our current capacity, it probably would not help to solve the challenge that we know should be solved in Nigeria, which is the fact that a number of organizations in Nigeria have overcapacity that are not able to utilize, because in reality, the capacity might be there, but maybe not to a global standard. So we took a very conscious decision to partner with a local company. Number one, to increase the capacity, to increase the standard, and to be able to put our volumes there so that capacity utilization would generally go up. And the reason for that really, because the end product we're looking at is that how can we best serve the Nigerian patient with quality medication at an affordable cost? And out of the options that we considered, we thought one of our biggest contributions to the pharma sector in Nigeria would be for us to build the capacity, increase the standard, the quality standards, of local companies and raise it up to global standards, which of course we work with. So it was a question of us actually bringing global best practices into Nigeria. And that is the basis for that decision that we took, that we're going to go into that journey of local contract manufacturing for some of our molecules in Nigeria.
Thank you very much for that detailed response. And so we move to pharmacist Popola. Can you also share with us why you made that decision?
Thank you very much, moderator and the House. Decision was made 18 years ago to go into contract manufacturing. The Reels as a business started out as scientific office of AstraZeneca in Nigeria. And after some years, AstraZeneca decided to exit some liquid lines. And those liquid lines, we already have enough critical mass in terms of volume. So when the products were exited, two of the products, it was Refusil suspension and that time Ketras syrup. So we took a decision to look at probability of local manufacturing, but we look at the fact that those two products might not have enough volume for a plan to be set up. So we approached the local manufacturers and they agreed with us to manufacture the two brands for us in 2003, 18 years ago to be precise. And that's how we set out. As of today, we have 4 contract manufacturers for us as a business. We have 15 registered locally contract manufactured products. And as at the last count, we have about 4.8 billion tablets that we manufacture for us in one of our brands. And also we have about 2.3 billion bottles of 15 syrup, or 15 ml syrup, and about 5 billion 100 ml syrup. So it's been a good journey.
Thank you very much for the insight you shared with us. And then we move to Folake Odediro. So I'm sharing my mic with you. So.
Thank you, Mr. Moderator. Hello, everyone. Maybe before I share who we are and why Sanofi decided to embark on local manufacturing, maybe it's in place to say it's a great honor to share this platform with you, pharmacist Adepopola. The reason I said that is that he was the MD, and he still is the MD, group MD now, of Reels 20 years ago when I started my career, my very first job out of the university with Reels. Today, I sit on a platform with him, he as MD of a flourishing local company, and myself as the MD of a multinational organization. And I thought that it's a good place to start my talk around. It's a good proof of concept of not just how multinationals and local companies leverage one another, but how talents can be harnessed just because you have players in your economy. Thank you for that opportunity 20 years ago. So a little bit about who we are, Sanofi. So my name is Folake Odediro. I lead Sanofi in Nigeria and Ghana. Sanofi is one of is the 5th largest pharmaceutical company, a big producer of vaccine. We were with you eradicating polio. And we definitely are on your yellow fever card, if you've got one, just to mention a few of what we do. But again, to answer your question, why did Sanofi decide to do that, to go into local manufacturing? I think it's very simple. We have a long-term view of our interest in Africa. Arguably today, Sanofi is the largest pharma in Africa by revenue. In Africa, and we have a long-term view to commitment to Africa. So that is one of the reasons. The second reason is that if you look at the forces that drive demand in pharma, availability, affordability, accessibility, and quality, one of the ways you can reinforce them and accelerate those forces is to make sure that those essential medicines are available. So we took a long-term view of Nigeria and we decided to go into contract manufacturing because we believe in Nigeria and we wanted to accelerate the forces that ensure medicines are available to Nigerians. Thank you.
Thank you very much for that insight you shared with us. And the opening anecdote was particularly interesting for me. And to the very next question here, we want to get some understanding of your involvement in contract manufacturing. What has your experience been, and what key learnings have you garnered over the years in getting this done? I'm sure some of your other colleagues here who are also CEOs and those aspiring would like to hear what those experiences have been and how you've been able to do things and get results. And so this time around, we are starting ladies first. She spoke last, but we are starting with her.
Thank you. So Sanofi was incorporated in Nigeria in 2000. So you could say we're relatively young, about 20 years old. But 8 years into that journey, precisely in 2008, Sanofi decided to take a leap with its ambition with regards to operation in Nigeria. And as at 2006, Sanofi had identified a local company that it thought that it could partner with in contract manufacturing. And in 2008, a contract was signed with 4 products. And Sanofi started production in 2010. So I think it's important to mention that between the time the partner was identified and production started, there was almost a leap of about 4 years, 2 years to identify, because there are issues. You're looking at an organization with at least the barest minimum standards and so many other things. I'll get into that. So we started production in 2010 with 4 products. And we did that for 10 years, proudly 10 years. Now, when I say 4 products, I'm not talking about the stock keeping units. So which means maybe there were more SKUs, but at least 4 distinct molecules. At about 2016, furtherance to its ambition, Sanofi started thinking of another organization. And I'll tell you why we do this. Because the evolution we seek usually will not happen overnight. And so if you want to be around for 50 years, you need to think a little bit further than 50 years. So at about 2016, we started thinking of a second partner, if you would. Why? Because of capacity, because we wanted to scale up and accelerate what we had. Little did we know that it was just, is it foresight now if you use that kind of thing in business? By 2018, the existing contract we had, the partner pulled out. I was the MD then. I think I was just 2 years into my journey as the MD, and I got a mail saying, we've been bought over, and due to certain, you know how it goes, we want to pull out of this contract. I recall we went to them with the management committee, the local management committee. We appealed to them. We said, it took years to get this contract running. It took years to find an organization with a barest standard, to identify, to do a quality audit. These are some of the learnings. To identify CAPA, corrective actions. It took years. Don't pull out. If you're doing some restoration, we can give us a break, 6 months. We will plan the forecast, produce, and we come back. It was a no. And maybe this will be one of the things that I'll say around what we need to take note of. It's not just a contract manufacturing arrangement, but a framework that protects the players within that framework. So this this partner pulled out. And by 2018, we had no local told you as at 2016, we're already thinking. And just a year after we pulled out of that, we got another contract running. I think that's another proof of concept that we are committed to Nigeria. And maybe not every company will put down a plant in Nigeria. So in 2019, we got another contract signed, and we're producing now. We signed with 4 again, but as of today, we're just producing 1. Because the journey towards quality, towards technology transfer, towards CAPA closure is a long journey. In terms of learnings, I mean, it's been yo-yo, it's been up and down, which is okay. I mean, that is how things work. But really, for me, we had a setback. If we had stayed with the previous partner, probably we won't be going from 4 products to 1. And maybe that's one of the critical things I want to say around our learnings. In terms of opportunities, of course, availability is a big thing. When we were producing locally, we had medicines for Nigerians that were proudly made in Nigeria. It was a big deal. Today, we had to go back to NAFDAC, the regulators, to initiate a process of approval for bringing in products that were previously produced in Nigeria. We received a lot of support from NAFDAC, but trust me, it's been tough. Because each time we have to make a memorandum and say this will be the last time. So you see, it was that hitch And that break in the contract really caused a lot of pressure. In terms of benefit, again, our site availability, we had access, because it's one thing for products to be available, but it's another thing for it to be accessible to the citizenry. We had a good price point. I think it's fair to say that, because we were sourcing, or at least we didn't have to deal with importation apart from the finished raw material. But in terms of challenges, and I will just hand over the mic now because of our time. I think the biggest for us is, one, identifying a partner with the BRS minimum standard. That took a while. The second one was the quality control checks, and the fact that after the quality control checks, there were corrective actions and preventive actions that needed to be taken on, and that involved some degree of investment. And the partners were not exactly willing to commit that degree of funds to just corrective actions. But that is the minimum standard that our kind of organization would allow for medicines to be produced. I round up by saying I'm not really sure the context is an unwillingness to localize. I do believe there is an innovative mechanism that has been set up by NAFDAC, but that it's also been operated on by multinationals and even local companies. I think the real challenge is a proper framework and a will to stay on it with regards to what should be done and what needs to be done so that we move Nigeria forward. It doesn't matter if it is not which factory was it produced on. I think what matters is it is made in Nigeria, not who owns the factory. Thank you.
Thank you. I think you deserve a round of applause for that. And so we move to pharmacist Okwola to also share with us briefly what the challenges have been and what insights do you think your colleagues here can learn from your journey.
Thank you very much. The experience has been positive and negative. The negative side, let me start from the negative side. Because of lack of experience in contract manufacturing in Nigeria, when we started, the contractual agreements were defective. Number one. Number two, a contractual agreement in Nigeria are not enforceable. So it was a challenge we had that I want my colleagues to put their mind on. And that's where NAFDAC will also help us to look at how to protect the tollees. I mean, the person going to contract agreement because they are the one that will drop the contract for you. So they will put clauses that will benefit them. And you might be on it for 2 years when we are trying to get it right. So the first one is the issue of contractual agreement, that they were not willing to even look at it. They signed it, but they were not fulfilling the tenets of the agreements. For example, we say you cannot do the same product. The next thing we say is that you are doing the same product. And you are not demarketing us by not giving us the right volumes. I face that. Then the issue of the issue of capacity. Because we are a marketing organization, we can start a brand today, and within 3 years, the brand will multiply. We started from zero, and our current local manufacturer is about 25% of our turnover. 25%. One of our top three is locally manufactured. So it can easily scale up because of our marketing efforts. But the local manufacturer does not have that competence in marketing. So suddenly they find out that you are making more than them in their own factory. That's the challenge the MD of the company had. And he called the production director saying, why is this man always coming every month to manufacture this product? Why can't we manufacture the same thing? And it's a challenge. And I have to personally seek an appointment of 2 weeks before I could even have the same industry. He gave me 2 weeks appointment. And I pleaded with him to please make one batch for me. So, I mean, you are talking of challenges. That's why I'm saying that. So, but the contractual issue should be looked at. The technology too. With time, the type of product to make will need some level of technology, which the manufacturer might not be willing to invest in. Currently, the CAPA issue, they are not willing to invest to make sure that their factory meet the right CAPA for your type of product. It's also a challenge we have. So it makes us to look for other contract manufacturers. So before you go into it, look at the capacity of your partner. So that's why I'm appealing now, if I drop my microphone, to NAFDAC, to be flexible so that you can have an alternative manufacturer when we are going out, because we go out because of our limited experience in how fast the volume can grow. So, and if NAFDAC said you cannot do anything in 5 years, second, third year, your volume is already multiplied by 5 of what they can handle. You have a challenge. Please, the NAFDAC should please look at that. So that makes me to be moving. And now we have 4 contract manufacturers. That's what is the cause. Thank you very much.
Thank you very much for the insights. Let's give him a round of applause, please. Well, he shared them with us. They may not be positive, but at least he's sharing them with us, and we get solution for every other person coming behind him. And so over to you, sir.
Thank you very much. So if we look at on a broad basis, we look at contract manufacturing and how other countries have used it to leapfrog into building the capacity of their countries as a pharma manufacturing powerhouse. This is contract manufacturing basically as what has helped countries like Singapore, like India, partnerships and collaborations with multinationals. That's why where they are now. When they started this journey many years ago, they probably were starting at the same level where Nigeria is now. But with that collaboration with big pharma players, with the multinationals, they were able to actually leapfrog to become manufacturing powerhouses. So it definitely is a model and a template that would be very helpful for Nigeria and really should be embraced by all, by the regulators, by the policymakers, by industry players, both the multinationals and the local players in the industry. How has the experience been as a company? I suppose it's similar to my co-panelist. It's been a mixed bag. For the first thing I want to mention that it takes time, it takes patience, it takes resilience. For many reasons. One of which, for instance, is there really is no published open database of the capacities of the local manufacturers in terms of what they can do, in terms of their quality standards. That publication does not exist, or at least I'm not sure anyone here on this panel has seen that. So when you are exploring, when you do an RFQ to say you want to work with a local manufacturer and they kind of come up with all form of codes, you are acting with faith, so to speak, and you will take what you are told as what can be done. It's when you begin to go that you then realize that a CAPA needs to be done here. Oh, there's a gap here that needs to be closed. You need to do it beyond what you think. You need to actually now begin to co-invest with them, with some of the partners that you have before you can actually begin to manufacture. So one of the things that will help, for instance, is that very open published database of the capacities of the various manufacturers, where anyone can sit anywhere and say, okay, I would like to work with you on this. So that's the first thing, because it does add a lot to the timeline. So you'll have an agreement, you'll have a plan that, based on what you have heard, you could start manufacturing. You could also do a bit of tech transfer and some manufacturing in 2-3 years. And you realize that it's not so. It's going to take you 4 years for you to meet the global standard that you're used to. Because as multinationals, there's a minimum standard that we can work with. The standards we bring to the table are the same everywhere. If we partner with any manufacturer in Nigeria, one of the benefits is that it's going to enable the manufacturer to export to anywhere in the world. Because once it has a stamp of GSK, this is by GSK. It's the same thing, can be exported to anywhere in Africa, anywhere in the world. And for that to happen, it needs to meet that same quality standards that we have other parts of the world. So it does take a lot of time. It's not something that happens in 1 year or in a couple of years from what you see, from the baseline that we have currently locally. So that's the thing about the timing, about the resilience, about the patient. And it's also been mentioned that there probably is a need for a stronger framework to protect both sides, both the contract manufacturer and the multinational, whoever wants to partner with the multinational. Some basic frameworks, for instance, in terms of contracting, in terms of the elements of contract, in terms of if you do this, you probably should not do the same for yourself. If we agree on volumes on a monthly basis, except force majeure, there's no reason why this volume should not be obtained. And because one of the things that business needs is predictability. So effective contracting framework is really, really very important. And I think I would strongly recommend this to our regulators. By the way, in the journey we've been with some of the partners we've had, NAVDAC has been very supportive of that in terms of various audits, but it's taking a longer than expected. And by the way, what we're embarked on currently is not our first experience. We had a first engagement probably about 20 years ago. And for a number of reasons, we had to stop that. Some of the reasons why we had to stop that have been mentioned. Not that we didn't want to continue, but there was no framework of adherence to contracting that to enable us to continue.
Thank you very much for your insights as well, Mr. Oyelana. And so you mentioned something which I think is a good point for us to dwell on a bit for about 2 minutes. You mentioned the tech transfer that comes in at times when you approach some of the manufacturers that work with you. But generally, there have been issues about the quality of talents and technical expertise in giving what manufacturers like yourself would expect when they are trying to engage those that will produce for them locally. So how do you think contract manufacturing can drive technology transfer, can make the local competency even better than it currently is and be as good or even better than what obtains anywhere else in the world?
Excellent question. And really, that's probably part of the essence of contract manufacturing, bringing global best practices into our situation, to our local situation in Nigeria. I can tell you straight up, for instance, that we're probably doing right now what is probably one of the largest tech transfers into the pharma sector in Nigeria. We've had training program for our partner for over the last 2 years, very continuous training virtually every month. And we've had people come from our global sites, experts. We brought experts into the country to advise, to upgrade, to check, to audit. So that's part of it. So we train people, and we've been doing that training continuously. We introduce higher standards so that these standards can begin to approach what standards that are available in our factories in Johannesburg, in the UK, anywhere in Europe. And that's the bit about the transfer. It's about building capacity of people, such that overall the people that the entity that will benefit overall is Nigeria. Because once you train a person for a contract manufacturer, that training is there permanently. It's not going to, it can't be taken away. Even if in 10 years' time we stop manufacturing or do everything, that training is there. That capacity already has been improved. That global standard has already been brought there. The global best practice is already ongoing. So it can only improve the overall standard of the pharma industry. That's what other countries, especially in Asia, have done successfully through these partnerships, through this collaboration. There's no reason why Nigeria should be different. It's just for all of us to have that realization that collaboration probably is the way for us to go in this regard. That is what will enable us to leapfrog, like I mentioned earlier. Not everybody will be able to have if every company in the world decides to come and set up a factory in Nigeria, what's going to happen? You're going to have overcapacity. None of those plants will be efficient. So that's why the partnerships are pretty important. And that's why they should be supported by policy, by regulation, and by contracting frameworks.
Thank you very much.
And also by the support of the regulator in terms of giving adequate time for this to actually take place.
Thank you very much for those insights again. And then we move to Pharmacist Popola. Talking about this support, a very interesting topic that we hear, not just in this industry, but everywhere else, is finance. And recently, there was the 100 billion fund that was set apart to support the pharmaceutical industry. And so I would like to hear your thoughts. One, what has been your own experience as a player in the industry and in terms of this fund helping to drive contract manufacturing?
Thank you very much. My experience in that area, I've been fortunate that I was able to access for machinery for a contract manufacturer. Over the years, you find out that they could not afford to purchase some machineries. So when this opportunity came for access to that fund for machineries, the CBN fund. We just applied like any other one, and we are lucky. We got the funds and we deploy it to support our contract manufacturer. There are some machinery that are needed. Number one, to scale up the volume. Number two, to improve the quality. Well, we find out that there are certain level of quality that you'll never be able to achieve at their level of production. And number three, to look at also to help them with some CAPA. Is a big risk we are taking on them. And we believe that over the years, we are going to get the benefits. But sometimes we always ask them, just put our name on it too, so that if we decide to cancel our contract, we can take our thing out of your factory.
Okay, so over to you, Falake Odediran. So in line with this question on finance, how much more of this do you think needs to be devoted to contract manufacturing, in particular, in order to give the industry the support it needs to produce the right quality and the right volume? There's 100 billion for the entire industry, but how much more do you think needs to be dedicated specifically to contract manufacturing to get the right results?
So I like that you started with pharmacist Popola because he's a local manufacturer and a big player, and I guess is most apt to answer this, but a lot more. Maybe I will not be prescriptive, but definitely a lot more. But maybe it's good to say, probably first it's important to identify where the gaps are. Because again, for me, if you know what the gaps are, then you know what to finance. Really, he was just talking about financing for equipment. I'll share an experience with you. I think sometimes last week, our CEO, the CEO of Sanofi, was being interviewed by Harvard Business Review. And, you know, Sanofi is a pharma giant in vaccines, in different therapeutic areas, but we're yet to come up with a COVID vaccine. And someone would have thought, what happened? But today, Sanofi is manufacturing billions of doses of Johnson & Johnson vaccines, of AstraZeneca vaccines, of biotech vaccines, but people don't even know. And, you know, during that interview, even I was alarmed, even as a Sanofi employee, to know how much Sanofi was involved. That is collaboration. Now, that is time saved. That is maximization of resources, if you would. So really for me, first of all, we need to know what are the gaps. And I guess that's what Kule was alluding to when he was talking about some form of assay to show this is what we have in terms of capacity. This is what we have in terms of machinery. This is what we don't have. And then the regulators can know what to support. Is it equipment? Is it training? Is it exposure? Because the frameworks are different. Sometimes when we do quality audits and we come up with CAPA, some CAPA will require a total overhaul of an entire assembly line. And then probably then you can assess funds. So I may not be prescriptive in saying this is how much billion. I'm not sure it's first the money. In my view, I think it's first, where are the gaps? What do we need? What do we need to do? When we did the quality check for the second partner that we went into contract manufacturing with, it was not just about the standards that we had as an organization, but it was also a way of supporting and saying, oh, you still use this machine, you may want to consider this even for your own production. I remember that meeting was so robust that partner came back with a lot of thank yous because of the benefit. Now, no amount of money will take care of that. So in my view, really, the money is good, maybe another 100 billion if you want me to be prescriptive, but more importantly, let's do a quality check. What have we got? How many factories today can go into contract manufacturing? What can they manufacture? What do they need to upscale? And then how many multinationals are willing to partner with them? And then we know where the gaps are. What do they need? Last but not the least, from my end as a multinational organization, the biggest challenge we had is Forex. So today, not only are you not able to expatriate the funds you're making, every day we're sabotaged with devaluation. So if there's any funds that can be provided, if there is a window, a market window that can allow me to access Forex so that I don't lose the revenue that I make year in, year out, and I don't have to constantly defend to my principals that Nigeria is viable, probably that angle could help an organization like mine. Thank you.
Thank you very much. I thought we were going to give another round of applause. And so I would also like to inform, for those who want to ask questions, There's a platform, Slido, the hashtag #FARM, PHARM. With that hashtag, you could post your questions and they'll be shared with us to ask the panelists. We are rounding off on this panel, so if the questions come in, we'll take them. But for subsequent panels, please use the hashtag to check on Slido platform and share your questions with us. And for the final round of questions, we have one going to Pharmacist Popola, then we have our other two panelists taking the final one. When COVID-19 came up and disrupted everything from 2019 and especially 2020, the supply chain was seriously hit. And so even when people needed medicines to be cared for, some of them could not be gotten locally because the supply chains from overseas had been disrupted. So from your own experience as a local player, a local giant in this industry, what lessons do you think have been learned in ensuring that contract manufacturing is better positioned to weather such storm, if God forbid it ever happens again, that such disruption to the global supply chain would leave us, at the mercy of till God knows when it goes away?
Thank you very much. Well, my first experience when the COVID hit was that all products that were already ordered were stopped from being shipped. That means there was a gap in the market. But our contract manufactured products were still ongoing. Because what you need to do in contract manufacturing is just to bring in the APIs. And the excipients are easily available. But once you bring in 50 kg, 200 kg of APIs, you are doing well. Why they stopped inspections. They were not even going to factory to inspect. No inspections, nothing was being done. It's actually caused a gap in the supply chain. It was that time that NAFDA now even decided that when you get to Nigeria, we will now inspect. Because it was so bad that they were not going out to factories to inspect. So it caused drug security challenges. But the locally manufactured products for us were still ongoing. Because Nigeria never really shut down for more than 5 weeks. But India, China, some part of China, they shut down for longer periods. And that means they could not supply Nigeria. By the time they lifted the restriction, maybe 3 months, they have so much queue up and so much gaps in the market. So the locally manufactured products for our side was just ongoing. We never had an issue with it. But the imported one, we had the supply chain challenges.
Okay, great. The locally manufactured ones, how much of a dent do you think you were able to make in terms of the demand from the market?
How much of it?
How much of the market need were they able to meet?
Currently, we never, I will not be able to say how much of it. But like I told you, our local manufactured products is just 25% of our annual turnover.
Okay.
And that one, we will say in the year 2020, it was more than 2019, okay, which was because there were gaps in the market that we're able to fill.
Okay.
Because you can source your bottles locally from Better Glass, can source your PET bottles from 1 or 2 places, can sort your cap out, and some active ingredients can easily be brought in. So it shows that if we can get it right with local manufacturing, we might be able to save when there's a crisis. Okay. Also, by way of doing local manufacturing, you also have a benefit of the foreign exchange that you are going through. Mm. You have the benefit of foreign exchange. It helps out. Thank you very much.
Thank you very much for that. And so we move to Kunle Oyelano for the final round of questions. Most NAROFAM members have global footprints. And so we'd like for you to share with us, working with a multinational, what are the key lessons you can share from other countries that have implemented successful contract manufacturing strategies globally that we can locally adapt here in Nigeria and learn from how they've gotten it right?
Thank you very much. I think the first key lesson is the fact that that collaboration that is enabled by local contract manufacturing between the multinationals and local players is about the fastest way for a country to actually scale up pharma manufacturing. We don't need to reinvent the wheel. There are global organizations that have the technical expertise, the material expertise, human expertise, and they are willing to transfer to local organizations. Why do we need to reinvent the wheel and still want to start in every country, want to start from scratch? So that's why I think local manufacturing should be on the front burner for policymakers, for regulators, and it should be championed in the country. I'll give you examples of countries where they are today. They've become net exporters of pharmaceutical products because they embraced contract manufacturing very, very early on. I've given some examples earlier, and I think it's what we should do for our country, Nigeria. Multinationals are willing to partner with the correct framework, with the proper timing and understanding in place. And just to mention a bit about that also, we've seen, even from the lessons of COVID, that probably one of the biggest lessons is that there's an African proverb that says that if you want to go far, you should go together, you shouldn't go alone. Polaki has shared experience of where our companies manufacturing vaccines for other organizations, and we've seen that in a number of places. And we should go from a mindset of the fact that we are in the industry, we're all competitors, we're all this, to say we can collaborate for the benefit of our country, for the benefit of the patients, for the benefit of the industry. If the global expertise that exists with the multinationals is brought to the country in full on the platform of local contract manufacturing, the standards in Nigeria will be entirely different in the next 5 years. Nigeria, our country, will become a net exporter of pharmaceutical products. Currently, I'm not aware of any local company that exports to Europe or the US. But the fact is that when multinationals partner with the locals and able to raise their standards, countries and companies that are in Nigeria, local manufacturers, will begin to export and earn foreign exchange. The fastest way to do that is through local contract manufacturing. The template exists already. Let's drive it. Let's implement it. Let's support it. Thank you.
Thank you very much. And so finally, we get Folake Odediran's view on this question as well.
Thank you. So maybe I'll start first from the COVID, and then I'll talk about lessons from other countries. The reason I want to talk about the COVID experience is because for us, it was an insightful pandemic, if you would. Probably a catalyst for change more than anything we've ever seen. The first thing we noticed as a multinational organization was a shift in consumer buying patterns. I'll tell you why. COVID is an infection, but Nigerians started washing their hands and masking their faces, and children were not going to school. So with COVID, we noticed that the antibiotics and the anti-infectives were not selling. The chronic medications, hypertension, diabetes, and of course, cancer, rare disease, hematology, were the ones that were selling very premium medicines. But those were the ones that were affected by global supply chain. It's a big learning because really, it's not just about that we manufacture locally. We need to move beyond the frontiers of pain relief. We truly need to be quite robust, capturing different therapeutic areas if we're to be reliant as a country with regards to medicine. So because we needed products for diabetes, we needed products for hypertension, but those were the ones that were affected. So I had a meeting then with the region, and we got an approval to fly in 75% of everything we sold in 2020. It's one of our best years as an organization. But that was because we got proactive. We flew in 75% and we didn't change our prices. Of course, it hit our bottom line, but we were thinking Nigerians. I think for me, this is an example of the kind of commitment that organizations bring into this kind of landscape. And it was a big learning on COVID. But to your last question on experience on what other countries are there, I'll give you an example with Algeria. With a population of a little more than, 50 million, with an average age of about 27 years for an average Algerian, with a population growth of about 1.8. In 2008, Algeria made a decision and said, we're producing only 25%. I mean, it's in the books, you can look it up. Actually, there's an article on it. Maybe our head of communication could reference it later, Mr. Dimeji. In 2008, they said, you know what? Only 25% of what we take in Algeria is produced in Algeria. And so they created a stakeholders forum and they said, you know what, guys? You need to produce it here. We're not saying you must put in a factory, but you must partner with existing factories. And Algeria moved its capacity from 25% to 50% by 2018, 10 years. Why? Because they realize they need to deal with an ecosystem and every player is critical. But not also that. Algeria decided to provide reimbursement for non-communicable diseases. When Mr. Asuni, I mean, that was a very beautiful presentation. He was talking about, is it latent capacity of 58%? For local manufacturing to succeed, you need waiting supply, but also waiting demand. We need to create a system where the average Nigerian is catered for. Now, we could create some insurance and we could pay stipends, but there has to be a waiting patient base so that we don't have latent capacity, so that we don't have people who invest in machineries and then there is no production coming out of it. In my view, the evolution we seek is not going to happen from multinationals or local players alone. It's going to be a joint task of collaborators, regulators, policymakers, players in the industry, multinational, local, everybody coming together with a will to commit, not just to local manufacturing, but sound contract manufacturing and realizing that every person counts and no one singular party holds the answer, but we are all parts of the solution. Thank you.
Thank you very much. And so because of time, we would like to end the panel here. And again, I would like to thank our panelists for the insights they've shared. And we hope they will be willing to come up next time we invite them and still give us more of this good stuff. Thank you very much once again to Mr. Kunle Oyelano of GSK and pharmacist Ade Popola. Thank you very much. Yes. Panel 2. This one.
Malaka is moderator.
How do you pronounce this?
Emunjeze.
Emunjeze. Okay, great. So we would like to go to our next panel. The panel is on contract manufacturing, the way forward. And so on this panel, we have, as moderator, I would like to call on our moderator to come up first. And so we're already familiar with this person already, and that's Folake Odediran. So could you please come up on the stage? She'll be moderating this panel. And the panel members for this session, we have Dr. Monica Emunjeze, who is representing the DG of NAFDAC. Dr. Monica, please. And we have Senator Ibrahim Yaya Oloriegbe, who is joining us virtually. He's chairman of the Senate Committee on Health. And then we also have a round of applause for him where he is. He's joining us virtually. And then we have Mr. Babagana Imam representing NIPC, that is the Nigeria Investment Promotion Council. Promotion Commission, apologies for that. And then we have pharmacist Ibrahim Binji, the Deputy President of PSN. You're welcome, sir. And so I'll hand over the microphone to Folake to take over from here. Thank you.
Thank you so much. This is balance. If we can give another round of applause, please. So first of all, I want to welcome the panelists, distinguished policymakers and regulators, all protocols duly observed. Thank you for joining us and obliging us, of course. And I welcome you to this panel and our goal. So the aim here is to discuss contract manufacturing a little bit more robustly to see how your various your various sectors regulate, supports, and what you think we should be doing with regards to contract manufacturing. So I'm going to be posing a few set of questions specifically to you, and I hope that we can get some responses with regards to that. But before that, I would like to set a bit of context, and I hope this is useful. Now, as we already know, countries such as India and Algeria successfully developed their local pharma industry and attained high level of self-sufficiency. Now, this they did by leveraging contract manufacturing, that is, by orchestrating large-scale collaboration between multinational companies who are the contract givers and local manufacturers who in this case are the contract acceptors. Now, the goal of this panel discussion is to hear from you, distinguished policymakers and regulators, how your function, your agencies will enable the necessary framework to accelerate the development of Nigeria's local pharma through contract manufacturing. So you're welcome once again. The idea here is not to be gender unbalanced or gender biased, but I choose to start with Dr. Monica, representing NAFDAC. So this is the question. Clearly, NAFDAC is the major regulator of the pharmaceutical landscape, and it has a significant influence on the successful implementation of contract manufacturing. The question is, what is NAFDAC's position on the subject, contract manufacturing, and how is NAFDAC ensuring the growth of contract manufacturing in Nigeria? And I'm happy to share my mic with you.
Thank you very much, my dear sister. Appreciate you. Let me first of all appreciate Nairo Pharma and Business Day for the invitation to NAFDAC and recognize the president of the PSN, ably represented by the VP, my classmates, Binji, and the representative from the NIPC. Good afternoon. Distinguished guests, the talk about contract manufacture would obviously not be complete without NAFDAC. I think even the keynote speakers earlier this morning did mention that. As you all are probably aware, NAFDAC is at the forefront of advocating for local manufacture. Drug security, medicine security, self-sufficiency is very key. You cannot advocate and move to local manufacture without having a place for contract manufacture. It is just only natural and expected. And from time, for those who go back in history and look at what you see, if you look at NAFDAC requirements over time, you will see there that there is a clear requirement that states you either have a contract manufacturing agreement or you have a power of attorney, which clearly establishes that NAFDAC recognizes that contract manufacture has a place when you're talking about access to pharmaceuticals. Let's jump to 2021. There have been quite a few policies in place with a view to driving local manufacture. Many of you are familiar with those. Most recent is the 5+5 policy and the NAFDAC ceiling list, which was recently updated. Part of that is the attempt by the regulator to push the pharma industry to look to see how you will move products from importation to local manufacture. And when you are looking to do that, the expectation is not that everybody will open a manufacturing plant. That is unrealistic. Many will look to form partnerships, as has been said here, and look to utilize capacities that exist within the country to manufacture products that can be manufactured within Nigeria. So I would say that we are definitely supporting and moving forward that agenda. We have continued to engage robustly with different stakeholders within the pharma sector. NairoPharm is one of the stakeholders, definitely. There are many other stakeholder groups. I see Naip in the room. I recognize you, my dear brother. I see Ipmin in the room. I believe Appin online, and PMG Man, and many other pharma stakeholders. It is very, very key that there is collaboration. I was very impressed with the panel before this. You can't talk about contract manufacture without collaboration. We might not all have the same perspective, but there's definitely needs to have a middle ground. Part of the contract manufacture is the framework. And I believe as an agency, we've been quite responsive and responsible. We have a guideline for contract manufacture, which is up, which is available, and which is also driven by requests from stakeholders to guide that process a little bit more. So I think you need to put a round of applause for NAFDAC for that. It might not be a perfect document, but it's a place to start. And I was very interested to hear some of the challenges that those that are actually playing in that sector. You have somebody who has experience of over 20 years trying to do local manufacture. He doesn't have a manufacturing plant, but he has engaged, and there are issues. And we should look to solve those problems as they arise. So as a regulator, we are responsive. We are aware that there are issues. But as we move to drive self-sufficiency and drug security, there's definitely a place for contract manufacturing. It's definitely something we need to look at. Quality is definitely an issue, and we in NAFDAC take that also very serious. Legal frameworks are very key. Now, I heard a call for NAFDAC to be, would I use the word an arbitrator or a bit more involved? We'd have to take a step back and look at that, because you have to be careful. We are regulators. So you have to be mindful that you don't blur the lines, but it's something that we need to look at to see. But definitely contractual agreements require that you have that expertise. The lawyers have to have a good part in that process. I heard somebody say, oh, the manufacturer will give you a contract and expect you to just sign it. My understanding is that it's supposed to be a roundtable discussion. They have their lawyers, you have your lawyers, and then you come up with something that favors both. How do you move to make sure that you implement or you stand by the terms of those agreements? Those become issues of law. Those become issues of law. How does the regulator play into that? Maybe we can look a little bit better at that, but I think we have to be mindful of that conversation as we go along. There's something else I wanted to make. We have to look historically at how we got to where we are. And unfortunately, I believe that we did not embrace, and when I say we, I'm talking to all of us, we did not embrace contract manufacture early enough in the pharmaceutical landscape. So what has happened is that most people that have manufacturing plants already have products that they're manufacturing. So you have the full contract manufacturing facility, whereas we should look to have facilities that are purely contract manufacturing facility. That is a business opportunity. That is a business opportunity where people will set up or convert their plants and say, I will stand back, I won't have products, so I don't have a conflict of interest, but I have a facility that can produce A, B, C, D, E. I see that as an opportunity. But like I said, we didn't start that earlier on. So if you have facilities that already exist, they're already producing products, and then you want to come and produce the same product in that facility, there are issues that will arise that we probably need to sit down and look at how to move those forward. I think I'll end it there for now. Thank you.
I'm sure we can do better than that for her. Thank you. Dr. Monica, I was totally enjoying myself listening to you. I don't know about others, and I liked something she said. And probably this is really why NairoFarm is doing this. She said, NAFDAC were regulators. There is this bit or this element of being arbitrators or maybe, how will I say, a referee. We will look into that. I think the reason NairoFarm is asking us is we are just trying to create a platform for robust dialogue. And I think part of what this meeting will bring out are such dialogue. We need to keep this conversation going, Mr. President. And I do agree with you, Mo, because sometimes also there could be an assumption on the part of the industries with regards to what the regulators can do. But there could also be an aha moment with regards to insights that we can share with the regulators with regards to what obtained elsewhere. I hope our reporters are taking note of what would be in our communique. Thank you very much. I understand Senator Ibrahim Yahya Oloriegbe is connected virtually, representing the Ministry of Health. I'm wondering, Senate, okay. Yes. So I'm thinking, I don't know if we can pose his question to him quickly or whether we should just move on. Is he connected? Are we on? Okay, very well. So the growth of the national health insurance, really, this is what this question is about. The growth of the national health insurance coverage of any nation is critical for patient access to essential medicines and the aggregation of demand for local manufacturing. Now, we recognize the efforts of the current administration, but we also know that Nigeria is, as we call it in Pharma lingua, 75% out of pocket. 95% out of pocket. The question is, what can the ministry do to drive further access to medicine through health insurance? Mr. Senator, please. In the context of contract manufacturing. It's having technical issues, so we'll go on. All right, very well. So maybe I'll just go to, please pardon me if I mix up the name, but I can always correct myself. I'm willing to learn. Mr. Babagana Imam, okay, representing NITC. I was born in the north. I schooled in the north. I'm a Yoruba guest, so I should be able to get Babagana Imam. Okay, this is for you, sir. The NIPC has over the years put together incentives to attract investment in local pharmaceutical manufacturing in Nigeria. Now, within the context of contract manufacturing partnerships, what incentives are available to companies exploring contract manufacturing? That's the first part of the question, and maybe a second part is, how can these incentives be assessed? Thank you.
First of all, the Nigerian Investment Promotion Commission is an agency of government that is with the mandate to encourage, promote, and coordinate investment in Nigeria. NIPC over the years has put in structures to achieve that mandate. We have a department that is called Investor Relations Department. That department is responsible for pre-investment and post-investment facilitation. That department also, has what we call back to your question, what kind of incentive do you have for the Investor Relations Department gives incentives to manufacturers, particularly in the pharmaceutical sector. We have what we call the tax holiday incentive. In the first instance, all those companies that are involved in what we call the pioneer activities and qualified can access that incentive. In the first instance, we give 3 years, and then after 3 years, then one, that the maximum of 5 years. We have that one. Then the other things that the department does is the aftercare services, which is even more important than the incentive, because you have to encourage them to retain them and expand. Then the other issue, also the investment, the department is also concerned with the pre-investment facilitation. We have what we call the OSIC, One-Stop Investment Center, where we have about 27 agents in-house promote efficient and coordinated service to investors. So once investor comes, within 24 hours, maximum 48 hours, they register and start business, be it incorporation, be it issue of business permit, customs, NABDAB is also with us. They have the officer. So we have a lot of agencies there. We have it. We have what we call also OSIG Lab. That was an initiative put in place where the investors, in the course of manufacturing, if you have problem or encounter any, challenges, you can write to us. We have, as committee members, the Minister of Finance, the head of service, the trade and investment and others, they would table it, look at it with a view to finding solutions. So these are some of the things. And then the one incentive which I can also give is the commitment of government to provide the enabling environment, which is a critical one. So thank you.
Thank you so much, Mr. Babagana Imam. A round of applause for him, please. I don't know if we were paying attention. He used the word we have like 5 times. And I was saying to myself, do we know? Mr. Shuremakun, again for me, another critical learning. We're moving this conversation forward, but the incentives are available. Are our players aware? What do we do? Who is supposed to move the conversation forward with regards to what is available? Maybe the part Mr. Babagana didn't answer was around how these incentives can be accessed. But when he talked about tax holiday, I was thinking, okay, is that applicable to multinationals as well? So thank you very much. I'll come back to you because of our time, but that was really well outlined and enumerated. Thank you so much. PSN, Farm Ibrahim Binji, good to meet you, sir. So I have a question for you, representing the PSN president, of course. And now, so firstly, congratulations. I think congratulations are in order to the new PSN president. As men and women of honor, we join hands. So congratulations on the successful election. Now, the PSN is the umbrella body of pharmacists in Nigeria, who are the bulk of the professionals within the pharmaceutical landscape. The question is, what is the PSN's position on contract manufacturing? That's the first part of it. And the second bit is, how will PSN foster greater collaboration? When Dr. Naomi was talking, she alluded a lot to the place of collaboration. So what is PSN position on contract manufacturing? And how will PSN foster greater collaboration amongst players within the ecosystem for contract manufacturing? Please. Thank you.
Okay, thank you very much. First of all, I want to congratulate the Business Day and Nairo Farm for this workshop conference. As you know, I'm here representing the president of PSN, Professor Cyril Osifo, who is unavoidably absent. He couldn't make it, so I'm here to represent him. As you all know, we are 10 days now into this our mandate. We have not even met. I think we met only yesterday through Zoom. But what we want you to know is that PSN, as an association of all pharmacists in Nigeria, we take it that the manufacturers, the community pharmacists, and all pharmacists were under one umbrella. And our position is that anything that will enhance, that will improve the activities of all these pharmacists, we are 100% behind it. So this contract manufacturing, PSN is in support 100% of this contract manufacturing. We know that it will be done ethically, and anything that's to do with the Nigerian society, with the Nigerian government, if it's within the law, we are 100% in support of contract manufacturing. To your second question, PSN as an umbrella, we have to collaborate with all sectors, with all NAFDAC, NIPRI, ACPN, Association of Industrial Pharmacists, and all stakeholders. And I know that within the next few months, we are going to be in contact with all of them and see how we are going to move our profession forward. I think there will be a great collaboration with all agencies of government and private government also. Thank you very much.
Thank you, Pharmacist Ibrahim Binji. Please, I'm sure we can make it louder for him. Thank you. It's definitely another yes with regards to collaboration. And we're moving this forward. And maybe I will just go back to Madam NAFDAC DG, represented, of course, by Dr. Monica, to see if we can take another question and we'll begin to bring this to a close. This is personal. Okay, but it's a burning issue for us at NairoFarm. And I heard you when you said it has been a lag with regards to contracts with local manufacturing, and probably that explains the acceleration that NAFDAC is putting in place. But really, we want to know some of the key challenges of contract manufacturing highlighted by previous speakers during the last panel session included demarketing and adherence to contracts. So we heard you when you said NAFDAC may not necessarily is a regulator, and in our own words, we are saying you could arbitrate. But we want to know, what can NAFDAC do from a policy framework, from a regulation standpoint, to ensure the adherence of both parties to terms of contract? One, what can NAFDAC do? I listened to Mr. Asuni's presentation. He was talking about the categorization. NAFDAC is talking 5+5. And for some organizations, the 5+5 is already here because you want to register a molecule and you are told, where is your plan? I mean, my organization is in that category. There's a molecule we're about to register, and NAFDAC is saying, where is your plan for 5+5? And I'm saying, I'm already manufacturing locally. I do not even have any plant today that can manufacture this molecule. Even if I have a plan, on what premise am I bringing it? So really, that's our question. How can NAFDAC support less demarketing, a bit of respect of the framework, and how can NAFDAC work in sync with the reality? We're not saying slow down, no, we're pro accelerators, but how can NAFDAC work in sync with the reality of what is on ground so that we move this conversation forward? If you would, please. Thank you.
Okay, thank you very much. Very loaded questions. I'm about to say maybe it's beyond my pay grade. But, like I said earlier, when you now start talking of contracts, contractual agreements and abiding by contractual agreements, that is a different realm. Where it affects us now is that contract agreement is a prerequisite for the registration of the product. So, like I said, we probably have to go and sit down and look at it. I can't make any definitive statements about that, but we hear you, and the discussion continues, and we look. I mean, we have lawyers in-house. I know the private sector has that legal muscle as well, so we'll look and see. But you see, I think we need to move beyond that. As pharmacists, and I say that with all due respect, I know not everybody in the room is a pharmacist, but we're men of honor. So where is the honor code in all of this? It's a question. Because if you have gone as far as to put down a contract that both parties have signed, which is legally binding, I think it speaks to also our culture as a people of not following through on legal agreements, because there's clearly a process. If you have a legal agreement and somebody does not meet, you sue. I think that's the legal language, right? It's not regulatory language. It's you sign a contract with somebody. It is binding. If you break that, there is recourse, there is remedy. And I hope there are some lawyers in the room that could probably attest to what I'm saying. So you have legal resource. But I think we are just now moving into a culture where people realize that there is something that can be done. There are lawyers that you keep on retainership for certain reasons. There are some people who went to school more than some of us for certain reasons. And I think we might need to look at those angles where we shift from this culture of, oh, I don't want to be the person to take Mr. X to court. It's not about Mr. X. These are corporate legal entities and these are legal requirements. And I think that discussion needs to be had, because trying to put that all on top of the regulator might not give you the desired outcome. Because usually when we see commercial issues, which is what that becomes, When commercial issues arise in regulation, we move aside. You want to now bring the regulator into that discussion. It might present a problem. I hope you're understanding, because we are like neutral. Our interest is public health and safety, access to quality medicines and all of that. When you start going into contracts and contractual agreements, that goes a little bit off from our image. I'm not saying we can't look at some issues, because as I said earlier, I think we started looking at contract manufacture more seriously later in the game. And so we have a peculiar situation in Nigeria, which probably doesn't exist anywhere else. So even all these references we make might not give us solutions that we can apply in our client, because when they started, this was not the pharma landscape they started with. So we have a situation where you have the largest pharma manufacturing hub this side of sub-Saharan Africa. And you're now trying to inculcate where we're trying to domesticate, have self-sufficiency, ensure drug security, use up existing capacity, not disenfranchise anyone, but still move and have access to quality products. So it's a totally different, what we're doing here is very unique. Might be sensitive to some people, but it's very unique because there is no cut and paste answer that you're going to bring from anywhere that will answer the situations that we have here. You have people that have been involved in contract manufacturing for decades. You have those that have been in the last 10 years, 5 years, 3 years, So there are different scenarios which we need to look at and see what answer best fits our situation. I talked about the partial contract manufacturing facilities, which is captured in that document that we came up. Understanding that, again, and I'm repeating it, most, if not all, of the facilities producing now have their own molecules registered already. And under an ideal situation, which doesn't exist, right? Under an ideal situation, you would say, if you're contract manufacturing product X, then you should not register that product for yourself. Under an ideal, I'm repeating it, we don't have an ideal situation, but under an ideal situation, Mr. X would have a facility that makes, let me say, vitamin C. He would not register a brand of vitamin C. His facility would be open for X number of people to manufacture vitamin C. Then he would not have a stake in the pie. But when you already have an existing concern, underutilized, capacity lying fallow, and we're now trying to bridge that gap, that scenario is different. But like I said, most of you in the room are businessmen, and I believe some people are already doing the calculation. There is opportunity there for contract manufacturing facilities under different therapeutic groups that you might need to explore a little bit more. What was the second question? Demarketing. Depends on how you define demarketing. Maybe I should ask you for a definition so I don't go on a tangent.
Actually, you had attempted really to answer that, which was part of the first one with regards to the fact that we don't have an ideal situation. Some of them are already doing this. Maybe what we will, maybe I will change, maybe infer it to is more around tech transfer theft. For lack of a better option, and what the regulators can do. And the reason, Dr. Monica, we really want NAFDAC views. You were right when you say NAFDAC is a part and parcel, not just NAFDAC, NIPC, everyone that is on this platform. The reason is critical is we do not have an ideal situation, but we need to advance. So what do the various players need to do to advance us? So you already have a factory where you manufacture vitamin C, and you want to manufacture vitamin C for me. What can the regulators do? Am I going to ask you, after 5 years, stop manufacturing vitamin C? I'm not saying that. Or am I going to say, this is the contract that is binding? What framework, what can we do to, it's like someone with an underlying condition, And then he comes down with a different thing. In medicine, usually the first thing would be, is there an underlying condition? So we have an underlying condition in Nigeria. We have a bit of chaos going on. What can NAFDAC do?
Okay, let me take the angle of the tech transfer. Because by the time you're doing tech transfer, that presupposes that that facility does not have that technology. That's the presupposition. If you're doing tech transfer to company X, presupposes that company X does not have that technology. That's why I'm transferring it. So again, you would bring in a bit of legality. If I do tech transfer to company X, for example, then company X cannot use that technology to make a product for himself. Yes, it should be part of your contract. And because we license the products, so at the point of that tech transfer happening, for example, you say, NAFDAC, this is the tech transfer that we are doing to company X, Y, and Z. Part of our contract, which would clearly state it, is that that technology cannot be used for any other company's product, including the manufacturer. If it's written down and it's signed and it's binding, I hope I'm making sense. If it's written down and it's signed and it's binding, then an attempt to breach is a breach of contract. Again, it goes back to the contracting. But moving it a little bit forward. So if company X now makes an application to NAFDAC using that technology for a product, we should be able to act. I hope I've made some sense. Okay?
Sure, we can genuinely give a round of applause. That was a bit intense. And really, for me, closely, I was looking at that as we begin to bring this to a close, Mr. Babagana Imam, NIPC. And I'm saying, if Dr. Monica says we are regulators and certain things are outside the ambits of NAFDAC, it's about legality. What about you, the gatekeeper? When I say you, I mean NIPC, when it comes to investment relation, what do you think the commission can do to move this conversation forward?
Okay, before I answer that, I missed the second part of your...
Yes, please, how the incentives can be accessed.
Yes, I think when you go to our website, the NIPC website, we have a form which is downloadable. You can download, attach all the requirements, the capital information, capital important certificate, the CAC, business permit, tax clearance, and so on and so forth. The right application attached to it, and that's the beginning point. I think the form is downloadable. So once it's an activity that is pioneer and is qualified, why not apply and assess it? So back to your second question. NIPC, one of the strategies that we can employ in attracting investment and also facilitating this contract manufacturing is, I think, through the initiative that we took of targeted promotion investment. We have, as a first year, about 22 countries, that we have chosen, based on maybe the volume of trade and investment between Nigeria and the countries, and also based on development of those countries. So we are relating with those countries, with our embassies, to target those companies that we can attract FDI. Because from what we have been hearing so far, I think what the sector needs, if we have that big investments, it will be good for the economy, it will create the necessary employment, there will be healthy competition and so on and so forth. And all these teething problems, I don't think we'll see it. But what you see, the capacity utilization of the whole players is 40%. And they want to, we're aspiring to reach 70 or 75%. So the gap is there, like Madam was said, the opportunity for the necessary investment so that we can develop the sector. For example, the Expo 2020 Dubai is going on. NIPC is also organizing event there, business forum. That's the kind of strategy we do, organizing foreign, business forums and so on. the trade and investment comes up, and we expect that Mr. President will also attend the event. Along the sidelines also, there are sectoral events. Why not you can collaborate with the NIPC, organize one of the events, maybe the manufacturing sector, so that we can get the necessary investment, attract those investments. These are some of the ways to go about it. But when you say our capacity is this, you have to.
Mr. Babagana, you are challenging me. Sorry, I'm interrupting.
Okay, sorry.
And I'm asking myself, probably NIPC should be the one hosting this event. And as opposed to me asking NAFDAC to arbitrate, you should arbitrate. NAFDAC should produce policies, and together we make Nigeria a great place. I think on my feet. And when you say Expo 2020 Dubai, I ask myself, what about Expo 2022 Nigeria? NIPC can organize that, partner with Pharma, because you see, attracting investment for me, sir, it's not really just about those who are coming. It's about how we identify the bottlenecks with those who are existing. We have 1,001 investment or sectors that are bleeding. And we're saying, probably, she used the word I like, maybe there are a few bottlenecks, maybe there are a few back and forth among the players. Can NIPC bring them together? I'm not sorry. You got this. That's that. So I'm just asking, do you think it's one of what we can do to shape these conversations?
We collaborate with all the stakeholders in carrying out our functions. Earlier, I told you we have the Holistic Lab. I don't know how many of the companies know that we have that mechanism. So it is only when you come and say, I have a problem, I'm facing this, then we can take over and then approach the government with the view to find a solution.
Wow. All right. So, very well. A round of applause for him, sir. It's a... Thank you so much, Mr. Shiremego, for allowing me to do this. It's a diagnostic thing that is going on here. It's like opening up a laboratory animal and you're identifying a lot of things. Because again, for me, it's not just that there are contextual issues, but there are also a lot of solutions in-house, but we don't even know. And I'm saying, NIROFAM is attempting to shape this conversation, but are we really the best people to shape this? I leave that for you, and I'm provoked, but it's not enough for us to come to you, sir. I mean, if I work with you and you can, okay, don't let me say this one before they fire me. If I work with you, I think we need to be a bit more aggressive, but thank you and respect. And last but not the least, as we bring this to a close to the PSN president. So I agree, we're just building momentum and all that. But how do you see the PSN? What part do you see the PSN playing in furthering, especially because we have a lot of backlog, in furthering locally manufactured goods in Nigeria?
Thank you very much. The PSN has to collaborate with all stakeholders for the way forward. That is number one. Number two, it has to take all its affiliates, the Nigerian Association of Industrial Pharmacists, community pharmacists, and all stakeholders to see that we achieve this. Number three, what is foremost in our mind is to see that quality, efficacious drugs are being produced in Nigeria, and it touches from the wholesales, distributors to wholesales to the retailers, and lastly to the common masses that will get these drugs cheap, affordable, and in the right doses and everything like that. So PSN will collaborate with all stakeholders to see that this happens in our 3 years of our office. Thank you.
Thank you, Pharmacist Ibrahim. Ladies and gentlemen, obviously, the evolution we seek is not going to happen overnight. What is important is that we move forward with intent. What I am particularly excited about is that there's a cascade of reaction that is already ongoing. We have the intent. Maybe I'll round up by saying this imperative is shared. It is a shared vision. The need to have contract manufacturing, the need to have locally produced medicines to ensure self-sufficiency of some sort for Nigerians is a shared imperative by the policymakers, by multinationals, by local industry players. And we all must continue to demonstrate commitment to this. I want to take some time to thank the distinguished panelists. I most sincerely thank you for sharing your perspectives on this topic, your enthusiasm, your imperative. The task of moving Nigeria forward, like I say, is a joint one. And we just want to plead that we need to keep this conversation going. Thank you and good afternoon. Thank you. Round of applause for them, and I'm sure we can take this photo.
contract manufacturing, as we have been discussing here, Nigeria may not have all the necessary capacities we need in this regard. That's why we are talking about contract manufacturing, where international organizations will join, even in our policies. Recently, Nigeria developed Nigerian vaccine policy. And in that policy, we recognized having PPP arrangements, because government cannot afford to do everything, as we have PPP arrangements, which we have started with Mayor and Mecca Nigeria Limited for the production of local vaccine in Nigeria to achieve availability and self-sufficiency. And apart from that, governments involved in creating enabling environments for foreign investors. So we are inviting foreigners both for direct investment in the country, that is direct foreign investment in the country, as well as partnering with government of Nigeria in terms of contract manufacturing, in terms of transfer related, that is transfer technology, because we cannot do it alone. That's the things. And even recently, we did we revised our national drug policy. This national drug policy is to promote local production in Nigeria. But as I have been saying, government of Nigeria have done a lot to present Nigeria recently. So much interested in local production, even the WHO, DG, this time you have had any time to reason with her, speak with her. People talking Nigeria has the population. We have the population. So we are inviting foreigners. Please come to Nigeria. We have the population. We have the contributing community. Please come and assist us. We can partner with you. We provide enabling environment to make it work. Thank you.
Thank you very much for those insights shared with us. And now we'll move to trade and investment part of this. So, what incentives? So we have incentives for manufacturers here, but in terms of contract manufacturing in the pharma sector, what do you think can be done to extend some of these incentives to also benefit this subsector?
Thank you. First of all, the name is Mayala. I'm not representing my minister, but representing the ministry. As a way of introduction, the ministry, the industrial, because this particular topic of today falls under the purview of the industrial arm of the ministry. The industrial arm of the ministry has a mandate of protecting, developing, and establishing industries in the country and ensure that contribution of manufacturing to GDP, ensure also jobs are being created. And this contract manufacturing we're talking about today is a welcome development, because this particular manufacturing is also happening in other sectors, and this has been the gap. And there's need for backward integration. The backward integration this time around is through contract manufacturing we're talking about, and we have some manufacturers, some importers that will be willing to set up factories or to the contract manufacturing in other local entities. I think what will be done is to have an industrial policy on pharmaceutical, Another thing again is to have industrial policy and contract manufacturing so that it will be sustainable. I had issues with legal issues initially when it comes to signing of contract, reaching the contract at the same time. I think what will cement it is this industrial policy of or the contract manufacturing also. Because there will be incentives as well. We'll propose incentives which will work with other sister agencies or other MDS to work together to see that yes, this particular sector will enjoy some incentives as well. As we all know, is zero import duty on machineries. Yes, zero import duty on machineries. This is the effort of the ministry that convinced the Ministry of Health and Ministry of Finance to see that yes, this thing will be done because other sectors like agriculture, the machineries are zero, so there will be need for zero import duty on machineries also for manufacturing. And as we know, the ministry has a statutory mandate of protecting the local manufacturing and identifying them as well, so that they will enjoy these incentives as well. I think what will be done again is to ensure that raw material as well as you for manufacturing. I think we extended to also look at manufacturing, to the contract manufacturers as well. Yeah, exactly.
Yes, thank you very much for this. And so I would like to go to the next question very, very quickly. So in as much as we are looking to support contract manufacturing and to get them to expand and complement what is already on ground. So there are concerns around underground and illicit of pharmaceuticals, which undermine the efforts of some of those who are doing the right thing, who are on the right side of the law, so to say. So as a ministry, that's the Ministry of Health, what are you doing or planning to do to give the needed support in ensuring that those who are undermining quality, who are operating on the fringes of the law, are taken care of, if we could put it mildly?
Okay. In Nigeria, we have regulatory authorities. We have NAFDAC, we have PCN, and they have been threatened to do all this work to ensure that at least ensure that all these things are put under as low as possible. Because like in Nigeria, NAFDAC ensure that it is only registered products that are being sold in this country. And those registered products must meet certain specifications of safety, of being efficacious, and of being good quality. And at the same time, we have NDLP that's ensuring that manufacturing is not done. And for example, in country Nigeria, what we are really suffering from right now is the issue of abuse and things like that. But NAFDAC ensures that only registered products are sold in the country, and as well, they have structures in place, institutional framework to ensure that diversion is not done. And the ministry is in support of all these things. We have a lot of regulations in Nigeria. The Federal Ministry of Health read the law policies, read the global regulations, read the global guidelines. And at the same time, we have a legislative framework that ensure enforcement of the provision of these laws.
Thank you very much. Finally, on investment. So, a lot of equipment imports from the finance needs for the pharma industry.
Can pharma equipment be imported at zero duties, for instance, offered to agriculture? And can VAT exempt reduce? Now, VAT exempt is likely to reduce the cost of manufacturing. Now, is it possible to also have this as an added incentive to the zero duty on equipment? Is it are these possibilities that the ministry can push and actualize in order to ensure manufacturing delivers better?
Yes, it's possible. The zero import duty is only on manufacturing nationals. Because when you sell pharma equipment, it means a lot. It might be like a finished product, which may not come at zero. But if it is a machine for production of that product, it will come at zero. We have also identified the sector entirely as an essential sector because we've learned so much from COVID and there is need. And we've learned so much from the COVID. The essentiality of that sector has made some products in that pharmaceutical sector to be non-vegetable. With approach FRS concerning some issues, basically medical devices, to see that they are non-vegetable. As a matter of fact, we have a policy which is awaiting federal approval to medical devices. And the level farm has made an impact on that, which they was approved for manufacturing. And I think it's a headway. We can implement that in the farm policy because they are working hand in hand. The medical device and the hospital, they are working hand in hand. But this time around, we have a separate policy because of their uniqueness. When it comes to incentives, we have to incentivize the local medical devices. Why? Because we have a comparative advantage on the syringe manufacturing, which will succeed in increasing the importability of the syringe to 70% imported. I think when we identify this kind of product in the pharma, we can replicate that also in medicine. Thank you.
Thank you very much for those insights you shared with us as well. And so we promise to keep this panel very brief, straight to the point. And so I'd like to thank our panelists for the insights they have shared with us. Before we go to the next panel, we will be taking a short break. But before then, we have some questions. So some people have indicated interest to ask us. Well, some of the panelists a few questions, and some have been posted online. So we are going to take some of those questions. So I would like to thank our panelists and invite
Okay, so we are going to take the question here. So this question is directed to the NAFDAC representative, and it's on technology transfer. I believe this person is trying to get clarification. The assumption that you cannot transfer technology to a company that already produces the same medicine. How accurate is this? I think this person needs some clarification on that. And there's a second one. If someone violates the terms of contract manufacturing, NAFDAC has informal rules to discipline erring parties. The capability to enforce is an entirely different matter. So how much of this is being done? So I think that makes it two questions. So I'll just bring the mic.
Thank you very much for the questions. When I answered the question on tech transfer, I think that's what I made a statement. I said it presupposes, if you're transferring technology, presupposes that that technology does not exist in that company in order for you to transfer it. So you said assumption that you cannot transfer. I'm missing it, but
so the assumption that you can't transfer technology to a company that is already producing something seems confusing to the person. That if the assumption that you cannot transfer it to a company that already produces the same medicine is a bit confusing according to this.
Well, I didn't say that, but if you look at the pharmaceutical space, if you're producing the same product, depends on the technology you are using. You could let me pick an active like ibuprofen, for example, and if you are producing like a solubilized product, for example, as against a tablet, or you are producing something that has film coating, that's what I'm talking about. So if the person has ibuprofen and doesn't have it film coated, it's a very simplistic answer, and you're transferring the technology. So they might have that product, but they won't have it in that technology. The point is you can't transfer to me what I already have. Then it must not exist. Then the second question was violation, informal ways to discipline, capacity to enforce. Well, I don't know how to answer that. When you ask the regulator, if you don't have the capacity to enforce, it's a very dicey question to ask because regulators have various ways to enforce. So that we don't do certain things doesn't mean that some things cannot be done. You know, when you are trying to be a little bit considerate for that, it should not be taken as a sign of weakness. It shouldn't be taken as a sign of weakness because we have various measures at our disposal when we talk about violation. And we have gone to even the extreme of blacklisting companies. It's on our website. So there are many ways to enforce, depending on what the situation is.
Thank you very much for the answers. And so we have some other questions. questions. I believe these are directed at NAROFAM. So someone says your name only, I'm reading it, or your name only is an issue. NAROFAM, Association of Nigerian Representatives of Overseas Pharmaceutical Manufacturers. What are the conditions that your loyalty is not 100% to your parent company with complete neglect to local manufacturing? What are the present state of patronizing made in Nigeria? I think that was nice.
No, that is a bit long, but I can get the gist of the question. But what I would say is that it's this. Our members, yes, some are multinational, some are local players. But for what we've been doing today, I don't see any other way we can show that we are Nigerians and we want something better for the country. By getting involved, I'm talking about the process that would enable Nigeria increase our local production of medicines. We've emphasized something very important. We said other countries where they have done contract manufacturing, they have actually collaborated extensively with the local players, that is those who are bringing technology from outside. And they have collaborated extensively such that
Why can't Nigeria replicate the Algeria model of producing 85% of what it needs locally and extend it further to make it mandatory for any NAROFAM member to go into one brand of products? I'm not able to see the last word here. I hope you get the gist of the question.
Again, it speaks to what we're doing here today. It's a process that we have seen. Like we said, there are certain molecules, therapeutic areas that our manufacturers locally are good at doing. And no one is saying that should also be encouraged to be brought in or imported. But there are areas where definitely we need some level of technology transfer. And these are areas where our member companies are coming in to say, look, let's follow a process of achieving this. There's no other way we can do this. We can't just overnight just have it happen. It didn't happen in those countries overnight. And that's why we're saying that it's a process. Contract manufacturing has been shown as a process that you can use to scale up production locally and also help your local manufacturers with their capacity. So for the Algeria model, I'm sure when the moderator was talking earlier, she mentioned something like almost about 10 years it took Algeria to move a certain percentage from 0 to a particular percentage. It took them almost 10 years. Now, Nigeria has started that process. And what we're just saying here today is that we can continue that process by ensuring that some of those things that are supposed to be involved in that process are really brought to bear for all of us to understand and follow through. Thank you. Okay, so,
yeah, thank you very much. You will add to that, and there's another one I believe also applies to you here. So you would add to that response as well. So what I have here is with the ceiling list, won't negotiation on contract manufacturing be more difficult as the local manufacturer has the upper hand in negotiations? For her, yes.
You see, Yeah, it's good. It tied into what I was going to add to what he said. The ceiling list is what it is. There are just over 30 line items on that list for which we feel very strongly that there is inherent local capacity to meet the needs of for those products. What that ceiling list means is that there are no new applications for importation of those products that will be granted approvals for. And those that have those products are required to transition over time to local manufacture. Does it give the local manufacturer an upper hand? Well, it depends on which side of the divide you want to look at it. But it is a policy thrust that moves forward this agenda very, very clearly. There has to be regulation and policy that drives local manufacture. And I can tell you that it is driving local manufacture. It is also driving contract manufacture, as imperfect as it may appear to be. We have seen an increase in applications for local manufacture of those products, and that was the intent. So I think on both sides of the divide, it's beneficial. The other thing that I felt I should make is this dialogue is very futuristic, because the dialogue has embraced even products that are not, by virtue of regulation or policy, part of 5+5. So they're having a very futuristic discussion. Most of the time when you're talking about tech transfer, you're not talking most of the time products that are on the ceiling list. If you look at the ceiling list from a medical or a professional perspective, these are molecules we consider simple. You don't see the complex biologicals. You don't see biopharm. You don't see vaccines. But you hear the futuristic tone of this dialogue, where they've gone ahead to look 10, 15, 20 years in. They're trying to go ahead of the regulation in this discussion. So I think it's well placed, and the ceiling list serves to push people in the direction that we want everybody, all stakeholders, to move towards. Thank you.
Thank you very much. I believe Folake Odedirion wants to add a thing or two as well.
Thank you, Dr.
We have a short
Monica.
presentation subsequently.
You do inspire me, not just because you're a regulator, but I particularly like that you're representing the DG NAFDAC. I'll tell you why, and this is on the ceiling list. I lead Sanofi in Nigeria. We have products that are on that ceiling list. The partner that we have a contract manufacturing which does not have the capacity. This is the feedback direct. The one we left, we went back to them, and our reason was at least they met the minimum standard that allowed us to produce with them. They do not have the capacity. So the team came back to me, my head of supply, in fact, it was just chatting, and they said, what are we going to do? Because we like to play by the book, because we do believe that the regulators are doing what they should, because there should be mechanism that advances localization. And I say, put together all the verbatim knows, so that when we go to the regulators, I don't like excuses. We're not just saying we don't want to localize. We're saying we have even tried and there is no capacity. I'm talking about availability of technology for those simple molecules. Now, I'm not saying that because Sanofi today is involved with local manufacturing, because as it's been alluded to, not every organization will do that. No, because the molecules are different, and different organizations have different commitment to investment relative to geographies. For me, Dr. Monica, the reason I'm saying this is so that, and I think that's what NIROFARM is hoping to achieve, so that we truly bring to bear what the issues are. Are these capacities what has been acclaimed, or are they really there? And I say this with a lot of respect. But today, we have worked with 2 partners, and none of them have capacity, and it's just co-amoxiclav. And this is the issue. So it's possible there could be probably other players who have this capacity. But it took a lot of, a lot of negotiation to get our parent companies to work with even that too. How do we move forward? So really that's why I wanted to respond to that, because I'm happy she's here, because she's a thorough regulator, and I know this will go back to the NAFDAC. I think we need to do some form of assay to truly know this molecule capacity is available 1, 2, 3. And probably assessed and orthographed by NAFDAC, if it's part of what is their jurisdiction. I'm so sorry, we're supposed to be friends. But again, this is, I mean it when I said I'm happy you're here, Dr. Monica, you know how I hold you. But really, these are the issues we've checked. So I've asked them to put together a position paper so that when we go to register those products, so the question is, do we deny Nigerians the availability of essential medicines because products are not yet being manufactured, and we're saying, don't bring them in if we don't have them? Forgive me, we subscribe to, as multinational, we subscribe to research organizations, and there is a bio-observation survey, SANISFE, for those who know them. We found out that close to 75% of products that have been banned are more on the shelves than those that haven't. I know that there's much the regulators can do, but what I'm saying is the issue is real. We truly need to advance local manufacturing, but there are things also we need to bring to bear. Where is the capacity? Factory 1, 2, 3, give us a laundry list, if you would, of what you have, of what you can do. And let NAFDAC, when we go to register, say, go to factory this. They can do this item that is on a list. Thank you. I was wondering if you wanted to add to that.
Thank you very much. Thank you very much. I've been informed that the short break is no longer needed. That we need to move on very quickly to the final panel, and with that panel we would be bringing it to a close. And so this third panel is on preparing the Nigerian market as a foreign exchange earner. And to moderate this panel, we have. Okay, good.
Sorry,
okay.
Yeah, it will be a bit rude if I don't say anything, and it's not personal. You see, a lot of times as regulators, we're in a very difficult position. I don't want to speak to specific molecules. But we have a very open door policy, right? And we're all in this together. As you rightly said, document your experience and bring it, right? Document your experience and bring it. The table is there for discussion, and everything can be looked at. Like I said, I don't want to speak to specific molecules, but from where we sit, and we do have ideas of capacity, right? We do have ideas of capacity, and we do have ideas about number of molecules registered under certain therapeutic groups. So you would speak as Sanofi, and you would speak as company Y, and we would look at the total picture. I hope you get where I'm going. We would look at the total picture and say, if I'm looking at molecule X and I have, let me just throw a number, 5,000. I'm just throwing numbers in the air, and I have 5,000 of product X. Certain percentage of that is manufactured locally, right? Should we continue to allow imports when there is local capacity to provide that product without bias to any company? You see, so sometimes it's difficult when you're dealing with companies, products, regulation, and the bigger picture. And then you look at another therapeutic class, and you have 10,000. I'm just throwing numbers. And you have 10,000 of that product. Out of that 10,000, maybe 5,000 are local and 5,000 are imported. I'm giving, yeah. So, and then you look at another product group, And you see that all 5,000 of that product, all are imported. Nobody is producing it locally. So you begin to see that the local manufacturers have capacity in certain areas and they don't have capacity in certain. That's a statement of fact. So where you see 5,000 that are all imported, would it be fair for me to go and say, go and produce locally? No. As we stand now, capacity does not exist. So let us continue while the sector builds capacity. But in those areas, there are countries where if you have only 3 local manufacturers, you cannot import that product. There are countries where if you have only 3 local manufacturers, you can't import that product. People are answering in the crowd. So, you have to balance it. I know you speak from a company perspective, but we speak from the other perspective. So there has to be a mid-ground where we find a way. In the midst of the COVID, Mr. Popola said it, ships were being turned back. He said they didn't even allow them. Ships were being turned back on the high sea with products destined for Nigeria. At what point do we know that we have to start looking at local manufacture? At a point where even hand sanitizers were being imported until COVID. Before COVID, we had about 20 local manufacturers. COVID started, we registered close to 300 local manufacturers. At that point, we said, don't come for import. We will not. Are we justified? Very much so. Of course. So, you have to balance it. And there's no totally right answer. But we need to all work together at the end of the day. Corporate objectives are fine, but also the national requirements are there. If we even talk about antibiotics, it is strange to think that at this point in time in Nigeria, let me not say what. If you look at parenteral antibiotics, how many local manufacturers for parenteral antibiotics do we have here today? With a population of almost how many? So if you have an infection and you need a parenteral, it must be imported. So where do you draw the line? When you look at antibiotics, you have different therapeutic classes, right? If you ask me, we're even operating at the first line. Am I correct? First line antibiotics, isn't that what we're talking about? If we talk about antibiotics, yes, we're talking about first line. At this point in time in Nigeria, should we really be struggling that hard when we have the intellect, we have the wherewithal, we have the capacity, we have the know-how? There are certain things that, we should rise above. We talk about vitamin C. Let's enlarge the discussion. You talk about vitamin C, and in 2021, vitamin C must be imported for you to have. I'm like, really? I hope. Okay. Yes. So your experience we would like to have, because we have the convening power to bring all the players around the table, and you say, okay, this and this and this is what we have. Like I said, there are quite a few products that have moved, and there are different experiences. We know of some. You provide evidence of what you have been able to do, and we bring the players and we see what next to do. That's the only commitment I can give to that. But definitely the discussion continues. Thank you.
Thank you very much. And so to introduce our third and final panel for today, and it's essentially the only thing standing between us and lunch at this point. So I'll start by introducing the moderator, Kunle Ademola, to please come forward. And the speakers on this panel, we have pharmacist Nnamdi Obi, who is joining us virtually, is chairman of APIN. Pharmacist Ken Onoegbu, NAIP chairman. market. Representative of IPMIN, welcome. Okay, Subramanian, okay, great. And so I'll hand over to Kole to please take over on the panel.
Good afternoon, ladies and gentlemen, and thank you for having a beautiful conference this morning. I thank all the panelists that we have had and all the presenters. So the next couple of minutes, we'll just be looking at the topic, preparing Nigeria market as a foreign exchange earner. We all know that the world is currently a global village, and Nigeria is struggling to diversify resources away from oil. And of course, the pharma industry, though might be a small industry, but it's very critical. So if that area can be enhanced to supply what we need for medical security or for medicine security, and we have some to spare to our neighbor, I'm sure
it is going to be a win-win situation for all and sundry, for all of us, if we divorce ourselves of this our parochial interest that is the bane of our moving forward in this country in the pharmaceutical space. Let us acknowledge that everybody has his or her core area of core competence that could be deployed for the general good of everybody. If you do acknowledge that, the manufacturer, whom I broke my heart for, all of them, you know for a statement of fact that it's not easy to manufacture in this very country. For any person who has taken that bold step, it should be applauded. The manufacturer should also take cognizance of his own limitations. Same apply to the importers. We'll also open our mind and work actively with our local manufacturers by way of this contract manufacturing that has been talked about. And there's something I wish to say very critically. As we speak today, there's no manufacturing concern in Nigeria that can compete effectively in Committee of Nations in African continent. Why? Not because of lack of capacity or lack of the necessary wherewithal, but because there are encumbrances that make it difficult, if not impossible. Imagine a situation wherein you get an import into this very country, say raw materials into Nigeria. It takes over 3 or 4 months for you to clear same at the ports. And these imports, the APIs, most of them are coming from India or China. And because our investment climate, our foreign direct investments here are not coming as it should because of the bottlenecks we have here. It costs a freight from China $15,000 or $16,000. The same item going to Ghana pays $4,000. So you have already a differential of $10,000. So a manufacturer in Ghana is going to be much more competitive than a manufacturer in Nigeria. Why? Because our ports are not investment friendly. There are a lot of bottlenecks. So many plethora of agencies at the ports that do very little or nothing as far as I'm concerned. Rather than extortion, that's the name of the game. That's the name of the game. It takes an average of 48 or 36 hours to move a consignment from a proper port to any warehouse in Lagos. So if you can imagine a manufacturer who is in any part of Nigeria, say in Ogun State, for instance, it's going to take that person 4 days to move consignment from the port. And these items that are being moved at the port are in critical need by these companies over there. Your guess is as good as mine as what it's going to take for somebody down there in the south, in the southeast or south. So what I'm saying in essence is we are going to be the architects of our own fortune in this country. NAFDAC I expect them.
You have raised some very important issues. The issue of collaboration between the local manufacturers and the importers are very germane, and even with the regulators. The issue of port that you have raised is there. It will come out as part of the recommendation of this conference.
It makes it important.
Sure
it makes it very difficult.
Will assist us cascading this down to the appropriate quarters.
Yes. The problem that the ports must have to be addressed.
Okay. And Honorable, you lead the industrial pharmacies, and these are people that work in these factories and in this market. Your people are involved both with the importers and with the manufacturer. And of course, you know the critical issues here. How does R&D through contract manufacturing partnership catalyze our ambition to become a net exporter of drugs in the near future?
Okay, thank you very much. Let me again stand on the existing protocol to address the audience. My name once again is Ken Honorable, representing Association of Industrial Pharmacists of Nigeria. For the benefit of those who does not know, NAIP is a technical arm of PSN that takes good interest of our members in the industry, importation, local production, even in R&D. So that's what we do in NAIP. Before I delve into the subject matter, let me identify one or two major areas, honestly, we seem to have forgotten. And that is a gap, a very serious gap. No matter what we try as much as possible to talk about drug security and the self-sufficiency, let us not forget the fact that, honestly, APIs, if we do not do anything about APIs, no matter what we discuss about local production, honestly, it amounts to nothing. It amounts to, honestly, bringing everything from India and from China. So API, which is active pharmaceutical ingredients, still remains a very major bottleneck for us to solve. And we have to find a solution to that before we even start talking about local contract manufacturing. That's one thing. Another major bottleneck we have been having is appreciation or understanding what it takes to be in local contract manufacturing by Nigeria. Honestly, we are lacking it. A situation where maybe you approach one company to do vitamin C, for example, for you, and they already have their product at 16 naira. And you approach them to do the same thing for you, and they're giving you 65 naira. You find that, honestly, they don't even create the enabling environment for you to survive in the first place. So, because thank you, they don't create it because they don't understand the dynamics. They are supposed to remove every marketing cost. Because you are taking this in bulk, you are removing every marketing cost from them, and they are making their money in bulk. But honestly, if you approach 20 pharmaceutical companies in Nigeria to do contract manufacturing, the price they will give you is even higher than their own market price in the market. So it is practically not possible. Now, because I'm speaking under the auspices of one, I'm a key player. I'm the co-founder of Pharma, and Pharma, we have about 46 products in the Nigerian market. About 6 of them are done locally through Ecomed, and of course, a plant in Owerri, Nalis Pharmaceutical. The other products we are importing from this. So I have this dual experience of being a key player and at the same time leading the NAIP so I'm going to combine the two. One, on NAIP, we have made two frantic efforts in supporting R&D. We have collaborated with NAPA, which is the Association of Pharmacists in Academia. So every year, we give them a grant to support their R&D. And to the glory of God, we have 2 beautiful products. NANIP, which is cough mixture from local herbs we have here. And the other one is Spinam, which is a cream containing some antimicrobial that can take care of all your dermatological problems. At the stage we are now, honestly, just going to approach NADAC for official recognition, endorsement, and then the other one is what? Commercialization. Everything was done at NIPRID here in Abuja. 2 beautiful products, well packaged. And so in terms of trying to earn resources for the country, I can tell you NAIP is at the forefront. we are going there. And this year, 2022, the lecturers again, the academy, they are coming up with another topic, another disease entity that NAIP will again give them a grant to do immense work, and then it also we are going to throw it inside the market. Then the other thing we have also done, most of you must be aware of what we are doing in Ebonyi State. We will have 110 hectares of land given to us to develop what we call the Pharma Park. The Pharma Park is a sort of encouraging what we call vertical integration. Everything you need to have in a pharmaceutical production outlet will be there. You don't need to go elsewhere to look for bottle, to look for water, to look for everything. Supply everything's income. And the CFO has been signed and given to us. We have done the groundbreaking ceremony last 2 months before we went for PSN conference by the governor. And what we have now, we have also formed the SPV, that's the special purpose vehicle that will drive the project. And as I'm talking to you right now, fundraisers are already on site, mobilizing to create the necessary infrastructure. Roads, we are going to build roads, we are going to build everything you need in a community to ensure pharmaceutical production outlay. So most of us here, we are going to be given an opportunity to come and have 1 or 2 plus to do whatever you want to release open. Not only, you don't need to be a NAIP member for you to access the benefits. And right there, honestly, one of the things we are going to do there is to build an R&D research lab. So during this PSN conference, we have the opportunity of discussing with the 2 principal officers of NAPSA. We have an MOU. We have NAPSA is Nigerian Association of Pharmacists and Pharmaceutical Scientists in America. Their president, Teresa Pans, came, and their president-elect, Emmanuel Ezirim Idogi, also we are there. And in the next 1 year or thereabout, honestly, we have already formed a committee that will start working on erecting an R&D lab there or anywhere in Lagos to support our academic pharmacists to come up with at least solutions to some of our common problems in the country and how to address them. So this and a lot more, honestly, is what NAIP is doing, because we have really identified that as a very big gap. That gap there is honestly R&D. And of course, educating our people on the need for us to collaborate to achieve excellence as far as the healthcare system is concerned. Let me stop there.
Thank you very much.
Thank you.
Thank you very much. It's good to know that API production is very important, and we all know this. Pricing too is an issue, and at least from our local manufacturer, I personally have such experience. When we have contracts and we buy from a supplier, he gives us at a particular amount. And when we approach him that since we have our own brand, if he can manufacture for us, he gave us double that price. And I had to be lecturing the man that there are 3 costs. Your production cost is different from my logistic and marketing cost. You can't charge my marketing cost, you can't charge my logistic cost. Charge only your cost of production. I told him he will get back to me. So we have a lot of experiences. Now it's good to know that again too that NAIP have actually made a giant stride in working in partnership with NAIP to come up with R&D, because R&D is very important if Nigeria pharma industry must develop. Thank you very much for that. I'll go to Mr. Venkat Subramani. You lead the Indian pharmaceutical concern in Nigeria. And of course, if we look at your model in India, it's something that we believe we can tap into. So looking at the Indian model, what are some of the key learnings and what Nigeria can take from India to become a net exporter of medicine within Africa?
Thank you. All protocols observed. Let me just give a brief about IPMIN. IPMIN is Indian Pharmaceutical Importers and Manufacturers living in Nigeria. So, everything what happens here and how we relate greatly impacts us as well as the nation. Coming to this, you have put a very interesting question to me. And this was a question which was given to me 11 years back. I think in 2011, when my good friend Naib, who is here, I was called as a speaker to talk about a perspective on Indian pharmaceutical industry and how Nigeria can replicate the same. And I know that we have come a long way. It was a dream. In fact, it was something I learned even about Indian pharmaceutical industry when I went through that, because it said that unless you are not challenged and you don't learn, you will not know what they have achieved. And I was really impressed by how the Indian pharmaceutical industry has come up, because more I was understanding it, more I fell in love with that, and more I wanted to replicate it here. And 10 years, 11 years down the track, when I see an enormous change, a platform which is created. I don't think that 10 years back we would have had this meeting to have a discussion. The very fact that we are having a discussion today clearly indicates we are on the path towards achieving not only self-sufficiency, but export. The very fact that Neuropharm is organizing this program clearly indicates that the interest of multinational in investing in Nigeria has awakened, which is a big thing. As much as we talk about imports and exports and numbers, let me still give you some very interesting facts. You may look at India today as something which is standing in top 10 positions. I think the 2018-2021 figures are also out, which says that it is probably in the 4th position or 5th position possibly in terms of value, but in terms of volume also is big. Initially, if you see in 2019 or 18, I think that in terms of value, we were in probably 13th or 14th position, while in terms of value, in terms of value was in 13th, 14th position, where in terms of volume was in 3rd position. What surprised me is that how come Belgium is in that place, which is higher than that of India. We don't talk about that. What was surprising to me is that Germany was contributing 16% to the net exports, in spite of having so much of competition from China and India, which we do not talk about. The very fact that, even today, we are not completely aware of the actual statistics. If we want to, here the point of the matter, what we are talking about is how we can achieve self-sufficiency and export. For that, we should begin with the end in the mind. You can achieve self-sufficiency if a lot of investment come into the country in terms of manufacturing. A lot of companies which are marketing their product believe in the manufacturers here and go about. It's not that the challenges are only in Nigeria. I have seen the challenges across the world. I want to be very honest. I want to be very practical. In India also, if you manufacture from a contract manufacturer there is a possibility that he may increase the price, and there is a possibility that we may have to search for another manufacturer to buy. And I have been an example of that. We today are proud to say that we are not only importing the products, but we are also manufacturing many products of us through our sister concern here. And believe me, the easiness with, some people said that the easiness with which I get the product manufactured in Nigeria, it's very difficult to manage the product coming from India now. The policies of government, specifically the support coming from NAFDAC, have actually created a platform today. I remember, Madam, 1 year back when you started, 2 years back when we started the program of CTD dossier, we are talking about exports. That's why I'm talking about this point. I remember that it was not easy for them to incorporate this in the minds of the people. Today, you have conducted training programs, you have supported people in terms of understanding it. What I have learned from that program is that I have started questioning my manufacturer that what production they are doing, what type of machineries they are using, what type of raw materials they are getting, what type of testings they are doing. While I'm asking these questions to them, I'm also learning within myself that what am I supposed to do in future? Because today a company which is producing a product for you may want to register their own product tomorrow here, may want to come themselves and establish themselves here in this thing. Ultimately, everything drives with commercial aspects of it, that what somebody is investing and what is going to be his return on investment. We can export if and only if our stomach is full, even in our house. So the first step for us is to achieve self-sufficiency, which is important in the current time. The most important thing today for us is that in case tomorrow a country is not able to supply the goods for any reason whatsoever, we should be sufficiently placed that we could produce our own goods. We should produce our own products which can save our citizenry, irrespective of whichever country it is. Number one. Number two aspect is that India is already planning up because, as the evolution goes on, people's knowledge about medicine, products increases. For example, initially villagers were not much interested in allopathic product. They were more interested in herbal product and other products. As people's opinion about the products changes, the demand for the product also increases. It is being contemplated now that Indian pharmaceutical industry, which is probably doing $42 billion, 50% domestic and 50% export, is likely to touch $120 to $130 billion in the coming 10 years. Today, Indian pharmaceutical industry, to my knowledge, has close to 3,000 manufacturers with 10,500 manufacturing units. 10,500. Now, not everybody is being made just to do domestic work. Some of them are being formulated to do exports. Some of them are doing formulated to do the contract manufacturing. Okay. So considering all these aspects, if we want to go to the next step, the most important thing is that we should imbibe what is coming today. We should look forward, we should educate ourselves, and we should focus on to see that how we can improve, our manufacturing facility here and support them.
Thank you very much. I'll get back to you, Sir Nabdiobi. I know you have a lot of idea and a lot of things to share, but just be mindful of time. This question I'm going to pose to you, I'll give you only 2 minutes, sir. So, Sir Nabdiobi, how can we leverage your contract manufacturing to boost the inflow of foreign capital, technology transfer to improve export potential of the Nigerian pharma industry?
I didn't get your question very well. Please, could you repeat same, please, if you don't mind? Hello? Hello? Hello?
Of Nigeria pharma industry.
Hello? 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 I'm not hearing you, please.
Can you hear me now?
Yes, I'm hearing you. Could you pose the question, please?
Let me repeat the question. How can we leverage your contract manufacturing to boost the inflow of foreign capital and technology transfer to improve our export potential in Nigeria? Okay, maybe while we wait for him, I'll go back to my chairman again. Good to know that a lot of collaborations and this is like the question I have here is that collaboration or competition, which should the Nigerian pharmaceutical industry seek to boost local research? Repeat the question again. Collaboration or competition, which should the Nigerian pharmaceutical industry seek to boost local research?
Of course, I will go for collaboration. Competition will always be there, whether we like it or not. Once you have 2 or 3 companies producing the same thing, of course, that's why we have quality differentiation. That's where packaging comes in. That's why efficacy of what you are producing comes in. Those ones speak for themselves. There's no need for competition when you have done the right thing. So, but collaboration will always give us an edge. And as I said earlier, I continue to maintain it. Honestly, if we want to really get a lot of export from this country to other countries, we have to do quite a lot of things in API area. Once you have the necessary APIs, we have a list of about 1,500 to 2,000 APIs. Why can't we as a nation have the basic, at least those ones that are commonly done in Nigeria, like paracetamol, vitamin C, all those common ones? Let us have the API. Once you have the API, things will follow naturally, honestly, without even you begging for it. But without APIs, even if you like, build the whole companies in Nigeria, build all the companies in Nigeria, without API, it is as good as you are throwing your own resources and economy to another nation. So once we have done that, then people will have the opportunity of producing, packaging it to meet best international standards. And of course, Ghana will come and buy. Germany will come and buy. But once we package all these products and when you look at it, they will look very, very local. Honestly, nobody will buy your product if you cannot meet international standards and specifications.
Okay, thank you very much. I know when we talk about capacity utilization, we talk about capability, we talk about quality. We are aware that even though India did not develop any of the COVID vaccine, or most of the AstraZeneca vaccine were actually manufactured by the Serum Institute in India. And possibly the reason because they have the capability, they have the quality standard, and they were ready for it. So, Mr. Banquet, how can improve capacity utilization from contract manufacturing overcome the challenge of overdependence on importation of both raw material and finished pharmaceutical goods?
It's a very tricky question, to be very frank. It looks very simple, but it is not as simple as it is. You know, I have come to this place that we will speak something and everyone will hear out and they will think in respective ways so that we can grow together. I want to add this question to a philosophical thing. You know, when a child is born, he is dependent on his parents and he has to be guided everywhere. But by the time he becomes a teenager, he starts thinking that probably he knows something more and he wants to explore things independently. Before he gets married, has children, learns that how difficult things were, and then he finds an interdependent world. I would like to inform you, as much as you see this, the exports of India, you should also look at the imports of pharmaceutical products in India. You'll be surprised to know that the imports and exports of India is almost the same. And it will continue like this. For example, in United States, if you see that their percentage of exports is significantly low, but it's still a country where things are being consumed heavily. It affects everyone. So to be very frank, you know, it is very difficult to, of course, it's an ideal situation for every country to be self-sufficient in all aspects of API, manufacturing, marketing, exporting, you know, which is right. But it is technically not feasible. So we have to go step by step. The most important thing currently is that even an API manufacturer would like to come and put his plant here, if and only if he knows that there are enough of manufacturing facilities here who will be able to take his consumption or production, and ultimately he will also be in a situation that he will be able to compete in the international market on price. We also know that today, if we are going to register a product either in India or China, we look at two companies and we see, okay, this company is giving this product for $1. This company is giving us for 90 cents. We look at if there is not much margin of, you know, difference in quality, you understand, and if they are falling on the standards, we prefer to go for the cheapest one. It's a normal technique. So that is why investment on infrastructure, you know, all the other things which are required, and, you know, the system has to be in such a way that it is able to support manufacturing, you know, of APIs. That is only possible if there is a background. And coming to the part of vaccine, of course, you know, India is one of the largest manufacturers of vaccine in the world. And it has not come out because of exports. It has actually come to take care of the domestic demand initially. Because India had a huge population. Today it is almost 1.3 billion. And if you are still dependent on somebody else for our medical consumption, it is going to be catastrophic for the country. And in fact, we will not be able to do anything. So that is how the thing came up. And today it has reached a stage that when there was a time to manufacture a COVID vaccine, they found India as a good ground by technology transfer to do that. Furthermore, I have also learned recently that that is Covishield was, you know, is a vaccine. Then Covaxin was developed by India, and there is Cipla also has developed some product. You know, it has gone. We initially were not signing the WTO agreement. Later we signed the WTO agreement, and now India is able to compete in the international market with all these things.
Thank you very much. Thank you very much. I'll just try again whether we can hear Sai Namdi for his concluding question. So, Sai Namdi, if you can hear me.
Yes, I'm hearing you.
I was asking you that how can we leverage on contract manufacturing to boost inflow of foreign capital and technology transfer to improve our export potential in Nigeria?
Oh, well, we just have to put the right foot forward. It has been said, I do love the submission that have been made by those in the panel with me. Once you put the right foot forward, once you put the right things, keep the right things in place, it has to be a concerted effort from all sectors. The government has to play its role. We have to have an environment where people have to have confidence in and come in to do business. We have to have an economy where the exchange rate is stable. I've been traveling to various parts of the world, and in most climes, the differential in the exchange rate for the past 15 years is barely a differential of, say, about 3%. But you can never get inflow of direct investments in an environment where it is today at 500 naira, tomorrow it's at 600 naira, the next day is 300 naira. We must have to do the right, get our economy in its right trajectory, and then things will move. And then get all these bottlenecks we're having in people coming to do investment in Nigeria. For goodness sake, why can we not get our port functional? Why is it so? Like somebody like my good friend here in the panel, if we do not have APIs in Nigeria manufactured locally, why can our petrochemical industry not work? Why is it so? You see, talk is cheap in this country. That is what I say. Talk is so cheap. This Nigeria of our dream can only be realized if all hands are on deck. If all hands on deck, we get to Nigeria of our dream. But if it's not, if we're pulling in different directions and so be clouded by pecuniary interest, it's not going to help anybody. We can't do a lot in this very country if the government is so sincere. If the government is so sincere, ask me, if the government doing more today?
The issue is that collaboration is very important. We need to continue to dialogue for all of us to move the country forward. And I think what we have done today is a step in the right direction. Thank you very much to my panelists, Sainam DOB, and my chairman, Ken, and my new friend today. Thank you very much.
Thank you.
Do you have a question? Okay, comment. Okay. Yeah. No, we need to take photograph. Yeah. Good afternoon. Hello? Okay. Good afternoon. My name is Kenneth Sahaniku. I run Neon Holdings as the CEO. And I have been listening to the presentations made so far at this function. And good to know the kind of preparing Nigerian market for all Nigerian manufacturers for FX learning, FX earnings.
I noticed that there are important aspects of the local manufacturing environment that has not really been discussed. And that is as it relates to government's economic.
Before we take the closing remarks, we could have Authority Jayola give us a rundown of the communique from the deliberations we've had today. So, Authoritative Janiola.
Just 1 minute.
Okay.
Please, as I'm representing the government of Nigeria here, please, what we need to ask ourselves here is, where are we? Most of our public health programs are globally funded. They are donated products. If they want to pull out, as they are starting to pull out one after the other, what will happen to the pockets? How many of our products in Nigeria are of WHO 3.5? Please, we want Eurofund to different from this platform. Please, go into contract manufacturing of finished products as well as APIs. Government welcome collaboration. Be it contract manufacturing, be it PPP. We have Federal Pharmaceutical Manufacturing Laboratory, Yaba. At the inception, this place was manufacturing over 30 formulation lines. Then by and large, production stopped in 2005. We want to resuscitate the place. We want to go into contract manufacturing or even technology transfer. Please, let us work together to help this country, Nigeria. It is our country. Let us not be unfair competition with important products where we can manufacture our products in Nigeria. Thank you.
Thank you very much.
Good afternoon, everyone, and all protocols to be observed. I'm speaking on behalf of the communicate team and the team at the back, Dimeji, myself, and this colleague. I can't remember his name. So I'm just business day. I'm sorry, business day. So we just try to highlight some of the things that came up so that when you get back, we can have some takeaways that we can say as a team, this is what we heard and this is what we've taken. So some of them are not totally. Is that okay? Can you hear me well? That's better. Okay. So business day, I must say. So one of the adopted communique from here, the first one is that drug security will guarantee production of standard and effective drugs that cannot be undermined during distribution to end users. Definitely, drug security is an issue, and as a country, we want to get there. The PwC report confirmed that 70% of drugs in circulation in Nigeria are imported, and about 70% of those drugs may be counterfeit in the supply chain. The federal government of Nigeria supports the drive for local manufacturing and recently announced a 10 billion Naira fund to support the local vaccine production, since it is very capital intensive and the government is making deliberate effort to make sure that Nigeria becomes a hub for vaccine manufacturing. And they did allude to the fact that we are currently very good with animal vaccines, and there's no reason why we can't be making human vaccines. However, a contract manufacturing framework is critical to ensure a level playing ground for all stakeholders to ensure sustainability. Collaboration, therefore, is that contract manufacturing has helped Singapore and India to leapfrog. We need collaboration with multinationals to become a manufacturing hub in Nigeria. Collaboration with all stakeholders is critical. A contract manufacturing framework is critical to ensure a level playing ground for all stakeholders to ensure sustainability. R&D is very important for us because we must develop local manufacturing in Nigeria. To be able to compete in exports, we need to focus on the production of simple APIs in Nigeria as well. To be competitive and attractive FDIs, and to attract FDIs, which is foreign direct investments into the pharma sector in Nigeria, we need to focus on improving the quality and the capability of our local manufacturers. The Indian experience showed that vaccines, India today became a vaccine hub because confidence was built in the quality of vaccines in India. And this was driven because India is a large population and they wanted to be able to meet local supply. Another thing to note is that a ceiling list needs to be aligned with proven and published capacity to drive the vision. Thank you. That's all we could capture. Okay. Some other people said it's not NAFDAC as a person. What was the last one? Because we can, that's why I read it, we can modify that as a communique. Because somebody mentioned that transparency, when the first panel sat, they did mention that they needed data to be able to say that if it's this line, that line, and then Folake also mentioned it. That's why I added it. So it might not be a NAFDAC speech, but as a group, it came out very strong that data is required to say this is what can be produced in Nigeria. Do we want to take that or we want to amend it? Okay. All right. Is there any other critical thing that we have omitted? Any? I'm waiting for hands up. Is there anything that is critical? Because we're going to finish up the communique based on that.
There's a legal handshake, there's for legal framework, where you have to have the professionals, some of that is not regulations. Contractual agreements need to be solidified, and then people need to use the legal system to seek legal remedies.
Contractual agreements need to be solidified.
And then legal remedies, if you have a breach of contract, there's recourse in the legal system.
And then I can also contribute to say that from all the agencies of government, there seems to be a consensus that there is a commitment from the sides of everybody, NIPC, NAFDAC, to support this agenda of contract manufacturing.
So I'll just add something that contractual agreements need to be solidified and we can seek legal remedies when those contractual agreements are breached. Lastly, there is a show, of all agencies of government are totally in support of this drive. The last thing that was not mentioned and discussed, and maybe at the tail end, is how often this kind of dialogue should happen. Should be an annual event, a quarterly event, half-year event. It's not in this communique, but it would have been good for us to have it in the communique. How often this kind of event should take place, so that when this communique goes to government, they know that this event is going to be an annual event or a quarterly event. What does the House feel?
In partnership with government agency, maybe probably driven by government agency, and then get one stakeholders to participate.
Okay, thank you, everyone. Thank you. That will be the summary. I still have a picture. Oh my God. Can my colleague join me? You are three now. Come and join. The communicate team, please come. I didn't quite get your name. That's why I was struggling here. Your mask. Mr. President. Mr. President. Okay.
Oh, yes.
So this is the president, chairman, as the MD. Okay.
Yeah, you're not represented.
Thank you.
Thank you. Yes, thank you very much. So we are done with the session, but so closing remarks by head of the advocacy team, that's all for today. So the head of the advocacy committee, please. So you are standing between us and lunch.
I'll try to understand.
A round of applause to welcome him, please.
Good afternoon, everyone. Still studying our existing protocol, and I would like to firstly thank everyone for taking our time. All key stakeholders that were invited, representatives. I want to thank you for honoring this event and for taking time to have this very interesting dialogue on the future of pharma, Nigerian pharma. On the communique, I think it's important for us to note that this was just the first draft of the communique. The more detailed communique will be circulated to all key stakeholders because clearly the discussion points, we have a couple of more discussion points that need to be included because, like we said, we have started the course of this discussion and the discussion has to move in a trajectory that we can continue with. I would always go back to the fact that we're all Africans and as Nigerians, we are storytellers. We love telling stories in this part of the world. And stories that define the way we see things in this part of the world. We have lived in stories that have created fear, concerns, and worries. The purpose, one of the key purposes of this session was for us to come together and try to define what a story would look like for the next 10 years. COVID has shown us that there's a need for us to retell that story. And for me, and for the bulk of the discussion that happened here today, it is obvious that the new story has to be one of collaboration, one that is built on data, and one that is built on a shared and common vision that speaks to the fact that we want to have clear goals. We want to have a clear desire of where we want to see the Nigerian pharma industry in the near future. When we say near future, we're talking about 3 years, 5 years, next 10 years, and if possible, the next 25 years. The conversation has started. Let's continue with that conversation. And ladies and gentlemen, I would like to thank you once more. Just from the screen. I don't know the shape from the screen. Okay. Thank you.